Good evening and welcome to day number 4 of the Global Jamaica Diaspora Conference. How are you today? I hope you're having a splendid evening and would like to welcome you to day number 4. Tonight's program promises to be an exciting program, and I want you to call a friend, let a friend know. You have to let everybody know that tonight is going to be a great night. Tonight, we're going to be focusing on two very important issues. Number one, we will be focusing on health and healthcare in Jamaica. What a tragic situation. You recently heard of the baby that died because of the lack of ventilator. Ladies and gentlemen, the healthcare crisis in Jamaica is in a very bad state, and it has been so for a very long time. I believe that change is required now. Change is required. We need to see better healthcare conditions and situations in Jamaica. So tonight, we will be challenging and having a conversation about health and the state of healthcare in Jamaica. Our guest tonight is a wonderful and a very informed gentleman who has years of experience in the field of health. Also, later on in our conference, we will be joined by a renowned ambassador who will be talking on the issue or speaking on the issue of foreign policy. So, ladies and gentlemen, now is the time we want you to call a friend and let a friend know that the diaspora, the Global Jamaica Diaspora Conference, day 4, has begun. So here's what I need you to do. I need you to go ahead and start liking and sharing this like. I'm going to give you a couple moments just to greet everyone that's here, but I want you also to copy the link and send it out so that people from near and far can join us at this conference. If you would be so kind and join me as we open up our program today with a word of prayer. Let us pray. Father, we thank you and we honor you today. As we're gathered here, we know that there are many things in a man's heart, but it is your will that come to pass. So we pray today that the thoughts that we have, the ideas that we will share, the solutions that we will seek, we pray, Father, that when we put all this together and mix them all together in this basin of love and patriotic mindset, that it will bring forth a wonderful and a perfect result that will bring the best possible outcome for the people of Jamaica. It will bring health, it will bring vitality, it will bring wisdom, it will bring guidance. So tonight, we submit our thoughts, we submit our minds, and we ask you that you will help us to analyze, dissect, and to be inspired with ideas and things that will change the trajectory of our country. Bless this proceedings. We tell you thanks in Jesus' name. Amen. Ladies and gentlemen, thank you for joining us in prayer. And as you continue to share this like for our day 4 of the Global Jamaica Diaspora Conference, I would like to take this opportunity as we begin tonight's program to introduce to you our first speaker. Our first speaker tonight will be Dr. Alfred Dawes. Dr. Alfred Dawes is a Jamaican medical doctor, healthcare advocate, and a public commentator. He's renowned for his work in surgery, particularly in the field of laparoscopic surgery. Dawes graduated the University of the West Indies, UWI, with a degree in medicine and later completed his surgical training, becoming a fellow at the American College of Surgeons. In addition to his medical practice, and yes, here's a shameless plug, Windsor Wellness Center, Dawes is known for his public health advocacy, featuring frequently addressing issues relating to healthcare access, quality, and policy in Jamaica. He has also served in various administrative roles within the healthcare sector, contributing to health reform and improvements in medical services. Dr. Dawes is a principal in the Crystal Lab Works in Stokey, Illinois, a research laboratory involved in cutting-edge microsampling and proteomic research. He also serves as a consultant to Apollon Formulatory, a medical cannabis and research center in Negril, Westmoreland, Jamaica. Dr. Dawes is a member of the Association of Surgeons in Jamaica and the Medical Association of Jamaica, the High Tech Surgery Club, and a fellow, as I said before, of the American College of Surgeons. Dawes is a regular contributor to the public discourse through media, where he writes articles and appears on programs to discuss health-related topics, raising awareness and educating the public on important health issues. Hot off the heels on his interview on this evening's program, Beyond the Headline. He's our first speaker tonight on day 4 of the Global Jamaica Diaspora Conference. Let's give a warm welcome to Dr. Alfred Dawes. Dr. Dawes, welcome to day number 4 of the Global Jamaica Diaspora Conference. How are you doing today, sir?
Hi, good evening. I'm good. And you?
Absolutely. I'm phenomenal, phenomenal. And please, I'm sure the people at Windsor Wellness will be very happy for my shameless plug. So, welcome as tonight's first speaker. Before you begin your presentation, I know you've been addressing the issue of ventilators and the lack of them and the lack of transparency. We will be asking you some direct questions concerning that, which is, I'm sure, not a part of your presentation, or maybe, but we're going to give it the opportunity. So if you could stay back after your presentation so that we can talk to you regarding the issue of these ventilators. Ladies and gentlemen, our first speaker, Dr. Alfred Dawes. Dr. Dawes.
Thank you. And good evening to all of the viewers, participants in the program. Today, I'll be speaking a bit about the healthcare system in Jamaica. And just to give you a background of where we are now is really telling the story of how far we have come. Now, Jamaica's healthcare system got its start in the plantation economy, whereby slaves would be dressed and nursed back to health in hothouses or hospital plantations. Many times it would be a plantation doctor who went from plantation to plantation, or it would be the African herbalists who imported the knowledge from their native lands of the uses of plants, etc., in healings. Interestingly enough, it is through that imported knowledge of African healers that we first got our um, first smallpox vaccine, whereby they found that if you got the pus from the pustules or the pox of someone with smallpox and then made a cut on the skin, someone who was naive to the virus, they would end up with a milder version of the virus and then they would get immunity. So healthcare really and truly was just dependent on the masters paying for these plantation doctors to take care of their slaves, and our own traditional medicine brought over from Africa. Of course, life expectancy was horrid, it was low. The majority of slaves died within 4 years, and that is why we had a rapid turnover of Africans from the slave trade. Fast forward to emancipation, 1838, there was really no need for these planters to maintain that care for their workers anymore. And pretty much what was left was just traditional medicine. So Jamaicans have, because of that history, been reliant on herbs. And this is why our first go-to in many instances is to get some bush tea or some poultice to dress ourselves or to treat a malady of illnesses. Now, back then, right up to you had the Kingston Public Hospital, which eventually was formed in the 19th century, but it was limited and many rural areas did not have hospitals as such. Um, Fast forward to the 1938 riots, where the Moyne Commission sent over from England, they really looked at the inadequacies of the healthcare system. At that time, we were inundated with infectious diseases. You had yaws, you had chigga, you had TB, and of course, before that, you had the deadly cholera outbreaks, especially in the 18, I think it was the 1880s, that saw mass graves being developed in Kingston in particular. So they realized that many of these diseases, polio, yellow fever, and malaria and so on, were all infectious. So what they suggested to the colonial government at that time was to expand services for the treatment of infectious diseases. This was facilitated by a grant from the Rockefeller Institute, and they did a lot of work on immunizations. Coupled with that, you had increased sanitation, better treatment of water, and public education on hygienic practices. So we had a decrease in dysentery, deaths from dysentery, and then there was a national eradication program for the mosquitoes that carried the deadly malaria virus. That coupled with the vaccination program saw Jamaica being the first country in the Western Hemisphere to be considered rid completely of polio. Smallpox, similarly, was eventually eradicated. Malaria was eradicated, yellow fever as well, but we just could not get rid of dengue, which persists to this day. Now, our healthcare system at that time was divided into the hospital-based providers and the clinics. And then, of course, based on the clinics, you would have the public health inspectors who were crucial to spreading awareness of these sanitary practices, the importance of vaccination, etc. My own grandfather was one of those public health inspectors, and he led the fight across Jamaica in several parishes where he was stationed in the eradication of mosquito breeding sites, encouraging vaccinations, and teaching ordinary Jamaicans about the treatment of water, the treatment for common conditions such as dysentery, for isolation, etc. Now, diseases such as tuberculosis were often lethal, but then there were, the TB sanitarium was developed, which is now the National Chest Hospital. Most of the doctors were British trained doctors, and we did not see the first set of doctors, locally trained doctors, graduating until 1953. They were the first graduates of the University College of the West Indies, which was then started as an outpost of the London College, University of London. So we started with a medical school program. Of course, we had some nurses before, but there was a traditional and Western medicine mix with many of these nurses. We know famously of Cuba Cornwallis and Mary Seacole, who blended the traditional herbal remedies that they had learned from that was passed down to them from their own mothers and elders to treat the British salesman, famously Horatio Nelson, and then Mary Seacole taking that into the Crimean War, where she set up her own hospital, and today she's still celebrated as one of the great British nurses. So we eventually started to eradicate many of these infectious diseases. With independence, we started to construct more hospitals, famously Cornwall Regional Hospital, which unfortunately was built hastily with a flawed design. So the design they took was straight out of Canada, and it had a boiler room that was under the emergency department, so it could be kept warm by the boilers in the winter. And the ventilation was kept at a minimum because you want to keep your warm air inside to avoid the cold Canadian winters. So Cornwall Regional, during this construction, sucked up a lot of the budget, and several hospitals and clinics had to be closed, notably Isaac, Barrett, and Ulster Spring was downgraded. All were downgraded to health centers, and just to facilitate the budget for Cornwall Regional's construction. That was the last major hospital built. You did have a couple others, such as Mapen Hospital being refurbished and new wings added during the 1990s. But we still did not have significant improvement. It was the same pre-independence hospitals that were slowly built upon. But the health sector, the health centers, we did see an increase in the number of health centers. As the staff complements increased, then you had better provision of primary care. So the primary care that led to the eradication of many of these infectious diseases and the decrease in the mortality rates from infectious diseases, that was one of the greatest accomplishments of our healthcare sector. So much that we were ranked in the top 10 healthcare sectors in the world at one point, based on how much money we were spending per capita on health and the outcomes. Jamaica was a country that was tropical, but was not suffering from tropical diseases. We were having life expectancies similar to those of more developed countries, while our neighbors were still battling with infectious diseases. But a lot started to change really in the 90s when we started to see the first explosion of obesity and lifestyle diseases. This mirrored what was happening 20 years ago in the developed countries, where especially the United States, started to see a proliferation in the obesity rates and diabetes, high blood pressure, etc. Unfortunately, we did not transition and pivot enough to face those emerging challenges. Whereas Cuba, they moved from a concentration on infectious diseases to start retraining these health inspectors and nurses aides to look for diabetes and hypertension, focusing on their control, making sure that patients took their medications, they were eating healthier, exercising, and so on. We continued along the trend where we were training and focusing a lot of the primary care system on infectious diseases. So as our diabetes rates steadily climbed, or hypertension rates steadily climbed, we are now seeing 10, 15 years later, after those significant increases in the early 2000s, whereby we're seeing the patients developing now the end organ damages that naturally accompany the uncontrolled progression of these diseases. So we're seeing more patients on dialysis. We're seeing more patients with strokes. As a matter of fact, we have about 7,000 Jamaicans getting strokes annually. About a third of Jamaicans are hypertensive, with about half of that number not knowing that they're hypertensive. They just think that the blood pressure is a little high sometimes, or the blood pressure was high one time, but they're not on any medication, or they just never know until they are screened. Or diabetes rates, it's about 13% of the population right now. Or obesity rate has climbed to where 55% of the population is overweight or obese. And we're doing another Jamaica Health and Lifestyle survey, so I expect that number to go up, because we have not done anything tangible in terms of addressing the obesity epidemic. So a number of factors have really led to that, whether it's change in our diets, more sedentary lifestyle, or environmental factors, and then, of course, the aging population does make a difference. One of the good things about getting rid of chronic infectious diseases is that you live longer. You live longer enough, and everybody who knows that the midlife spread is real, you tend to put on more weight over time. So an elderly, aging population that is heavier, that has a higher rate of diabetes, high blood pressure, and all of the attendant complications with end organ damage, whether it's kidney disease, the strokes, the heart attacks, people on dialysis, amputations, etc., eye disease, blindness, cataracts. We're seeing a rapid increase right now that is straining the public health sector. Coupled with that is the worldwide increase in cancer rates. Now, what we should have been doing is to focus a lot more on screening for cancer, but that is only now just coming into the picture as a priority. As a result, we have one of the highest rates of prostate cancer in the world, and not just that, we have one of the highest death rates from prostate cancer in the world, because most of the prostate cancers being picked up are picked up at an advanced state, Colon cancer, similarly, about 2/3 of all colon cancers detected in Jamaica are advanced colon cancer. And breast cancer, similarly, whereas the world is picking up more breast cancers at an earlier stage, Jamaica is seeing an increase in deaths from breast cancer because we are picking up advanced disease. Cervical cancer, similarly, a completely preventable cancer if you're doing enough pap smears and colposcopies and if you use the vaccines. That makes a significant difference. So where we are right now is that we are faced with what are commonly called Western lifestyle diseases. But the truth is that the burden of these chronic diseases is disproportionately carried by the developing countries because we have higher death rates for diabetes, high blood pressure, heart disease, etc. because when they cause organ damage, they require highly specialized care and facilities, and we just simply cannot afford to have that. So we're seeing an increase in the burdens on hospitals with very little expansion. Waiting rooms are full. There's a lack of bed space across the entire public health system. Surgeries are backed up. And then, when you look at the indices to see whether or not we're doing well, markers such as the infant mortality rate has gone up, maternal mortality rate has gone up, neonatal mortality rates have gone up as well over the last 20 years. So we're moving in the wrong direction in spite of an increase in the spend in the health sector. So we're at a tipping point as we speak, and my discussions about the ventilators are just one symptom that I'm focusing on in a health sector that is really creaking. But unless we accept that the nature of the diseases that we are treating has changed and our approach to these diseases has to be changed, we're going to continue to see a worsening of our health indices over time and frustration leading to further migration of the best and brightest that we produce every year. And the consequences are going to be disastrous if we do not have a whole-scale reform of the healthcare system. So I don't know if that is good enough. I wanted to leave enough time for questions because that is usually where the discussions get a little bit interesting rather than just listening to me, as my son say, keep yapping. So
your son is
over to you.
Your son is, I have no clue how interesting your yapping is. So I hope he's watching and tell daddy to yap on. But Dr. Alfred, let me ask you, as it relates to the ventilators, and I'm going to bring in the panelists right now, and they are ready to come on stage to ask a few questions. But as it relates to the ventilators, it's been in the news of late that ventilators that were donated to Jamaica can no longer, is not in the healthcare system. I heard you earlier on Beyond the Headlines laying out some statistics. I'm not sure if everyone who is on this conference had the opportunity to hear you earlier, but could you tell us a little bit about the state of ventilators as it relates to Jamaica and what is going on in the healthcare sector?
But unfortunately, I can't tell you about the state of ventilators in Jamaica because nobody can tell you about the true state of ventilators in Jamaica. We just don't know. There have been several releases, several pronouncements. We have heard numbers from 122, we've heard 150, I heard that is 105. When they listed out how many institutions had gotten ventilators, it added up to 54. So, and I know from people who are in the public health sector that some of those numbers were manufactured because what was sent out is different from what was provided. And I'll just leave it at that. But what I can tell you is that we are woefully inadequate in terms of the provision of high dependency care or intensive care for both adults and neonates. And this is what is causing a lot of the uproar now in Jamaica, because people are coming forward and telling their stories about their own experiences. And there have been some really heart-rending stories. I don't want to go into the details of that, lest I be accused of politicizing this. But the truth is that we're going to see a lot more negative news coming out of Jamaica with respect to people dying for lack of access to ICU beds. This is unfortunate because if you look at simply the neonates and the mothers, and a couple of years ago, 10 years ago, there was a $4 billion Jamaican dollar donation. The European Union gave a 22 million euros to set up high dependency units for mothers and neonates across several hospitals. And we don't know what happened to them. We know for a fact that they're not operational. And then during COVID, according to the press conference called by the government, they should have had 105 ventilators donated, again, from the European Union, the private sector organization, and private citizens who are concerned about ICU capacity. So we don't know where those ventilators are. Neither does the Ministry of Health, because they've been calling around frantically from I first issued that press release last week. So it's unfortunate, because this is one of the issues that we should really and truly be focusing on. Primary care in terms of monitoring and treating chronic diseases, screening, emergency care, and specialized care such as ICU care. All of these are really what Jamaicans go to the hospitals for. But it's alarming that we can't tell how many ventilators are in the public sector that are working.
Dr. Dawes, you are probably going to be the Minister of Health if the next election goes your way. What changes would you bring to the healthcare system? Because, I mean, a lot of us call politicians politricians. You know, you're filled with talk during your period when you're in the opposition or when you're running. But when it comes to delivering on those promises, they usually fall short. What concrete proposal would you say to the Jamaicans listening to you right now, and people in the diaspora especially, who wants to go to Jamaica, but the travel advisory say health care is woefully inadequate? What policies will you put in place to ensure that people, when they enter into the health system, that it is a system that will offer the kind of care and have the kind of resources and tools? And finally, what is your position on general EMR, electronic medical records for the country, where, as you rightly said earlier about inventory, there should be some kind of collective database where you could say, these are the list of equipment, these are in use at this hospital, and anyone could log into a portal and say, hey, I see that you have 4 ventilators over at that hospital. We're in need of one. Can we send a transporter to get one so we can take care of these patients? What are some of the policies that you would propose being the new Minister of Health?
Well, let me first take the whole politician argument. The funny thing about my entry into politics is that I was actively recruited, I guess you could say, specifically for the role of being in the cabinet as a health minister. And this is coming from my background of advocacy for years now, working at different levels in the public health sector and in private sector, as well as my social commentary and continuing lobbying for a better healthcare sector. So this is not just cheap talk to win a seat. Yes, I am running because I want to go the representational route rather than going through the Senate. But for me, this is another way of contributing. So my goal is to, when I leave, the healthcare sector is better off. I come from a family of service. As I said, my grandfather was one of the public health inspectors who did such a fantastic job in decreasing the burden of infectious diseases. My own father did 28 years as the head of Maple Hospital. So my mom's a teacher, it was a primary school teacher for a year. So I grew up with call it the DNA of service. So this is not just cheap talk. With respect to what I'm going to do, now, we know that this is not a money problem because the healthcare budget has tripled over the last 10 years. But yet we're seeing, as I said, the international benchmarks, the mortality rates and so on, and rates for diseases going up. So we know that it's a systemic problem. So if you take them one by one, there's a unit in the Ministry of Health called the Health Facilities Maintenance Unit, the HFMU. This is a unit that was conceptualized to maintain equipment. We know that there's an equipment problem. We know that we're getting donations. Some of them will require more intensive maintenance. We do know that we're buying different brands, so we're going to have service contracts. But the priorities were never to facilitate the upgrade and training and expansion of the HFMU so that we can have biomedical engineers deployed across the island doing preventative maintenance, having spare parts on hand, so we don't have to be taking parts from one ventilator to fix another one. And whenever you have a machine down, whether it is a patient monitor, an anesthetic machine, an operating theater bed, you have backup readily available. So there is no shutting down of facilities to replace equipment. Unfortunately, this is not the case. You have operating theater lists being canceled because of faulty air conditioning units, and it happens more often than you would imagine when we have a plethora of people here who can fix ACs. It's just really putting in place systems that doesn't require a lot of money. Yes, you will want to expand the cadre staff and training people and upgrading, but it is not going to make a serious dent in take for example, this capital budget for the Ministry of Health for this financial year is $11 billion. For comparison, the Ministry of Education, which is another super ministry, their capital budget is $2 billion. So when you're talking about money being allocated, it's just about where it needs to be allocated. I won't call it low-hanging fruit because you still need some effort to pick them, but the plans are already there. When you look at training, we're talking about training nurses, for example, and then as soon as they're trained, they go away. Work out something. Most nurses, they'll tell you they want to stay here. They want a house and a car. Give them that opportunity. We have NHT not being able to be utilized by the majority of contributors. I don't want to speak out of turn regarding other portfolios. Because of the collective responsibility of the shadow cabinet. But you can do things like incentivize nurses through owning their homes a little bit easier. You may look at retention through, say, look, you can work, you don't have to pay off any bond or anything. Give us 2 years, give us 3 years, and then you accept that you're training people for export. But when you do that, you're building the diaspora even more, and then they're going to send money back home. And we're getting $4 billion US a year from remittances, which when you compare how much of that money stays in Jamaica versus how much the $4 billion US earned by tourist interest resides overseas and never make it to Jamaican shores, it's still a win-win for the country. But we do have enough people here who will want to stay. And if we incentivize them staying, you solve that HR problem. For a lot of people, it is really the opportunity. They want to upgrade themselves, but then there's a lot of local politics involved and they just can't get to. Whether it is getting postgraduate places, in Kingston, for example, if a doctor wants to do residency, it's easier for them if they're already in the Southeast Regional Health Authority because they would be already getting paid by the Southeast Regional Health Authority, versus if they're coming from one of the regions in the country, they would have to try and get a job in Southeast, or they would have to get a scholarship from that region, which is very limited because the region would be paying somebody to go work in another region and still have to pay somebody else to fill that role. If you centralize postgraduate education spots from the Ministry of Health, they've done a little bit of that, but it is not enough. If you're talking about maybe 12, 15 places when it should be 200. So centralized training spots that the Ministry of Health pays anyone who is going to do further education, whether it is a master's or a doctorate, whatever it is. That way you can have independent movement of the regions without any waiting for scholarships or sponsorships. That's another simple one. When you look at screening for cancers, $1 spent on screening is much more efficient than $1 spent treating a cancer that is advanced. So prevention is not only easier to cheaper than a cure, it is easier than a cure. And if we spend more money developing, looking at the big cancers, mammogram, we only have one functioning mammogram in the entire public health system. That's at Cornwall. For colonoscopies for colon cancer, I remember I said earlier, colon cancer, about 2/3 of them present with advanced disease. Now, if you present to KPH, which is one of the few hospitals doing colonoscopies right now, with bleeding from your rectum, it is going to take you a year before you can get that colonoscopy done, unless you can find that money to go and do it privately. Let me say that again. If you present with one of the most obvious signs of cancer, it is going to take you a year before that cancer is diagnosed based on the availability of time. So what we have to do is to spend more time and money screening these tumors. Prostate cancer, same thing. Everybody over 40 should be getting their PSA test. Make it available. Don't just say it is subsidized like what is being banded around right now. Something can be subsidized, but it is not available. And with any screening test, it must be relatively inexpensive, it must be readily available, and it must be relatively non-invasive. And we need to use all of those characteristics to develop screening programs at health centers right across Jamaica. And that is how we're going to pick up a lot more cancers earlier, treat them better, so we have less loss of lives, less expensive chemotherapy, radiation, and surgeries that require ICU care. Similarly, hypertension, diabetes. I've seen in so many instances that patients would come to the emergency department, clog up the emergency department because they need a prescription refilled because the dates that they are getting at the health centers is far too long. So what happens is either they come and clog up and I say clog up because people with genuine emergencies have to wait for a longer time, and they're going to be on benches, they're going to be on cardboards waiting because their blood pressure is out and they want to have a prescription refilled. But you can't turn them back, because if you turn them back, they're going to get a long date at the health center because there's no doctor coming there. The doctors don't come often enough. The nurses don't have prescriptive rights. So they're going to go with their blood pressure is uncontrolled, the diabetes uncontrolled, and then present back to the emergency department with an emergency, a stroke or a coma, and then you end up in a worse situation. So my priorities would be screening, strengthening primary care. And this is, if you hear that it's a surgeon talking about primary care, people may raise their eyebrows because surgeons are notorious for just focusing on surgery and cutting things out. But if you look at the holistic picture, you'll realize that you'll save a lot more lives by spending resources and focusing on primary care to prevent people from coming into hospitals and needing surgeries. I also would focus on emergency services. So we don't have a proper ambulance system. What has been happening now is that ambulances are being used as transport vehicles to take people from the hospitals to private facilities to have diagnostics done, diagnostic procedures done. Now, you have to address that in two parts. One, you must outfit all hospitals that are seeing a significant number of patients with the diagnostic equipment that they need. A CAT scan should be a basic diagnostic equipment right now. The prices are falling enough. They're available, and you can set up where you can use teleradiology to go back to your electronic medical record system. We in the private sector use teleradiology a lot. I do mammograms at my place, and a radiologist is never there. Everything is just uploaded and they read remotely, and everybody gets their reports in maybe a day or two. So we know that we can develop these units so that you don't need ambulances to be carrying people back and forth. And then what happens is that so many people are being backed up in hospitals waiting for an ambulance to get them out. You may have heard the horror stories about that recently. But when you don't have an ambulance, you're just stuck. You can't get diagnosed. Imagine for days you're there with a stroke and you can't get diagnosed if it's bleeding or blocked blood vessel. So the doctors don't know whether to thin your blood or you would need surgery that can actually save your life. So when you look at it holistically, you can solve some problems by fixing ambulance services, diagnostics, primary care. And I think that with the reform of the health maintenance, health facilities management unit, and the HR component in terms of offering people an easier path to upgrading themselves and greater incentives to retain people. But if they're leaving, you work out something that they stay a little bit longer before they go off. I think that we can go a very long way in reforming healthcare in Jamaica.
Thank you, Dr. Dawes. Ladies and gentlemen, if you're just joining us, we're speaking to Dr. Alfred Dawes, the opposition spokesperson on health. Our panel is now open, and we're going to pass the mic around. Dr. Rupert, would you like to take the first stab? Any question for Dr. Dawes?
Absolutely. I want to welcome Dr. Dawes and a wonderful presentation. My God, I feel healthier just listening to him just a while ago. And I do watch your tidbits on TikTok, wherever they occur, Dr. Dawes. And you may not remember me because you're too small at the time, but you tell Kuba hi for me. So let me say this though, that when you listen to a young man like this, who is a doctor in Jamaica, you know that we have the best of the best, you know what I mean? And we really need to listen to them. I've heard him speak when he was at Spanish Town Hospital about certain things, wrote about it. And so it's very important. Now, I was very concerned about a young policeman who came to a woman who was trying to get a liver transplant. And of course, unfortunately, she couldn't get it in Jamaica, came here, couldn't get it here, and she passed on eventually. And also, I was just approached the other day about a burn unit that you guys are planning down there in Jamaica and so on. But you have other issues that are smaller but greater than those things. How do you see yourself? I know you've explained some before, but based on those two things that I'm saying, how do you see yourself in a capacity to do something about it in the near future? How do you see that? Could you explain?
Well, you mentioned the burn unit, and that is a question that has been asked. It's topical because every now and again you have these sensational stories. But what I would ask is, what is the guarantee that somebody with such a life-threatening injury who needs to get to a burn unit will actually stay alive long enough to make it there? Because the receiving hospitals where they would first be taken, they are woefully inadequate to manage burns to begin with, whether it is from the initial resuscitation or the emergency services to get them from the field or to transfer them to that burn unit. But so it has to be addressed in an overall review of a trauma system. We have to basically set up in Jamaica a trauma system from scratch. Now, to answer the question of how I plan to achieve all that, I've outlined some of what needs to be done, and the how is actually where they say the devil is in the detail. Well, we don't have to reinvent the wheel. Our diaspora is significant. I have had conversations with people Jamaicans who are overseas, and they're just dying to come back and help, but they just can't find that outlet. For one example, I was having a discussion with a Jamaican who is a case manager for one of the largest hospital systems in Florida, HCA. And when I told her of the bed issues that we had, she's like, well, all you need are case managers. So I was like, what does a case manager do? And what she outlined was that you would get a count of how many beds are available, then who is on the bed, who is close to discharge, and then what is keeping them from being discharged. Is it blood tests? Then you get somebody to get those blood tests done. If it is an x-ray, whatever it is, you make sure that is done. Is it a doctor who is being lazy to come, or you know, they're busy with something else? You get somebody to come and write up those discharge notes. Whatever it is, the case manager solves the problem of getting somebody out of a bed so that you can prioritize who gets in that bed. So when you look at it, it sounds so simplistic, but that is what these efficient health systems do, where they can have a rapid turnover of beds. And we have Jamaicans who are managing multiple hospitals. You know, they have reached that level of experience and seniority. When you look at trauma, there are so many Jamaicans there who are in emergency departments. They come and they run some. I mean, Trevor Dixon, a good friend of mine, he comes and he runs his ultrasound courses and so on. And that is how a lot of Jamaicans, even at Sablamar Hospital, when I was there as the senior medical officer, we moved from no ultrasound to having 2 ultrasounds with training in fast focused abdominal sonography and trauma, where the A&E officers were trained to pick up whether or not somebody had, ruptured liver, ruptured spleen, blood in the peritoneum. So one of the easiest things you can do is to facilitate the diaspora who are well trained and have the experience to come in and work side by side, so we can have capacity building and a transfer of information. The other thing, which is going to be a lot more difficult, and it has to do with the selection of the persons with the right qualities for leadership, where you can get stakeholder buy-in. You have to motivate the people to say, hey, we have to do better. So everybody's saying the system is broken, but then a lot of people, they allow the system to remain broken because it suits them one way or another, whether it's extra overtime, whether it is private cases, whether it is calling sick and go doing sessions, or not putting out enough because, there's not enough accountability. We need to motivate everyone in a health sector that has so much, so low staff morale and such a demotivated cadre of workers, that they can pull it together, and this can be their contribution to Jamaica to make things better. It's going to take a lot to motivate the staff, because they're working in environments where they don't have the resources, they're overworked, they're underpaid, and they would have had colleagues who they're comparing themselves to, who went overseas to greener pastures and are telling them what could be in Jamaica, but they just can't have it because for one reason or another, funding, political will, etc. Now, you have to get those people motivated, and that is going to be the hardest part. But if you get buy-in from the stakeholders, then it is going to be much easier. But that is where the local leadership and the leadership in the Ministry of Health will have to make a big difference. And this is where I personally will have to grow as a man, so I can be a good leader to motivate the troops. Mm-hmm. The other thing is that a Minister of Health pretty much wields the pen that signs off on the policy documents, the priorities of that administration. And one of the most reassuring things is that the shadow cabinet led by Mark Golden, we have all agreed that there are certain priority areas such as health, education, and security that must be addressed. So it's a priority for any administration that I will be in, and I know that resources would not be funneled away from health. But because health is so topical right now, anybody who forms the next government, whether there's us or there's the current administration is re-elected, Jamaicans know, because of what is happening, they will not accept anything short of a major overhaul of the healthcare sector.
Ladies and gentlemen, welcome to day number 4 of the Global Jamaica Diaspora Conference. Tonight, our first speaker is Dr. Alfred Dawes. He's the opposition spokesperson on health. Mr. Jeffrey Tavares from the Mequitalk program, I have a question for you, Dr. Dawes.
Good night, Dr. Dawes. Welcome to the program, sir. I had the pleasure of meeting you once when I was in Jamaica at the Salomon Hospital. I'm from Negril, and I had the pleasure of meeting you there. Dr. Dawes, I was just looking at something a while ago. A normal bed runs from 20,000 US to 55,000 US dollars. My question to you, on not a bed, rather, ventilator, I'm sorry. A ventilator runs from 20,000 US to 55,000 US dollars. My question to you, and also beds run from $679 US to $4,299 US or $995 US. It all depends what bed you want in a hospital. Huh? Am I making any sense there, Dr. Dawes, when I say that?
Yeah.
Okay. My question to you tonight, Dr. Dawes, you're the opposition spokesperson on health. If you should become, when that man put on in green clocks and decide to call the election and ring the bell, and if the People's National Party should win state power, and you become the Minister of Health, sir, would you order an audit in every single health facilities in this country? And then you maybe come to the diaspora or get a loan to refurbish Jamaica's health sector and come onto beds? Because to me, 20,000 for a ventilator or 55,000 for a ventilator, it should be chicken feed to the government of Jamaica, who has a $1.7 trillion budget, financial budget. So would you overhaul the whole health sector, sir, if you become Minister of Health? Minister of Health?
Well, thank you for the question, and I do recall us meeting. It's good to see you again.
Yes.
The health budget this year, when you look at the estimates of expenditure, it is just shy of $1 billion US. It's about 145 billion Jamaican. So just under $1 billion US was allocated for health. It's a matter of priorities, and as I said, there are several things that must be fixed: the emergency department, the diagnostics, ICU, the screening capacities, health center, operating theater, all of these things. But we have to know where we are as a starting point, and that is why there must be an audit nationally to see what equipment we have, what type of equipment, the functionality, and from there we can see how we're going to build out. So if it is that we really and truly have 105 ventilators and half of them are broken, we need to see how we can get those operational, what is going to cost, etc. But we have to have a starting point. It can't be that we're just operating in this nebulous cloud where we get donations and we can't account for whether or not they're working. It's too loose, and things have to tighten up. So we have to know where we are so we can see how we're going to move forward. So yes, there has to be a proper audit of all things public health system.
Mr. President, I have one more question, please, sir, if you may indulge me.
Please, proceed.
Yes. Dr. Dawes, I remember at one point, members of the Jamaican diaspora sent ambulance to Jamaica, and they sit on the wharf till Wappy and Philip dead. If you become the Minister of Health, sir, what can you do to make it easier for Jamaicans in the diaspora who wants to donate, to, let's say, to the Black River Hospital, that the ambulance get to Jamaica, and the person who was sending the ambulance don't have to pay this absorbent amount of money to clear it, and it goes directly to the Black River Hospital. Why is it that if I'm going to donate something to Salomon Hospital, does it go to the Ministry of Health and them decide if it should go to Salomon Hospital, yes or no? It should not be. I am from Westmoreland, and I want to donate back to my parish. So what would you do to make sure that when you're sending something to donate to Jamaica, Salomon, Black River, or whatever, we don't have to pay so much money to clear it? I think it is ridiculous.
I agree with you. And I remember that incident. The ambulance rotted down to nothing, and it never made any sense to clear it after a while. We have also had mobile mammogram units. We have had a lot of donations. I remember we had asked for a donation at SAV for an ultrasound, and then when it came, they figured it would be better served at the clinic in Mobay. So they took our ultrasound after we had done all of the negotiations to get it down and gave it to someone else. So we had to beg and get other ultrasound in order to get our unit up. But what happened is that it was just somebody deciding that this is how things are going to go. If you look at donations worldwide, even WHO, Bill Gates gives WHO money, but it is earmarked for particular programs. WHO cannot take that money and do anything else with it unless the donor decides that this is what it is going to be for. We have seen instances where Shaggy and Friends, that controversy, again, because of donation rules, the money was earmarked for a particular charity, and because they could not enact that charity, the money is still sitting in a bank account. Now, to have someone donate something and then you decide that the donor does not have that authority to earmark their donation for the charity that they feel most attached to, that is just wrong in every sense of the word. It turns off donors, and then what you do is to create a situation on top of that where it is difficult to get the donations in. There have been workarounds where other people get charities. So if you know that somebody's sending down something, they will raise the money for the fees to clear it. These are waivers. It was more waivers can be granted. It was more difficult during the time period when we had the IMF, where they were insistent that we must collect all the revenue and there can't be any waivers, no ministerial discretion, etc. But a lot of that has changed, and I believe that we need to look back at how we deal with charities, because it's not just health. People are donating computers, laptops. There's a lot of back to school donations for the education sector that people have to be paying duty to clear those donations, and kids are missing out on these gifts, you know, and many times it is vulnerable people who are suffering at the end of the day. So I believe that you know, you're giving me homework now. I have to take this to Shadow Cabinet, but the review of the donations policy and how we can make donations cheaper to the donors. But with respect to health specifically, it doesn't take anything at all to say if a donor earmarks a particular donation, whether cash or kind, for a specific institution or program, it must go to that institution or program.
Thank you, Dr. Dawes.
Thanks.
Thank you. Ladies and gentlemen, thank you for joining us on day 4 of the Global Jamaica Diaspora Conference. We have Dr. Alfred Dawes, the opposition spokesperson on health, with us tonight, and we are taking questions from the panel. Let's go ahead and bring to the podium the one and only, the rebel himself, Mr. Wilfred Rattigan. How are you, Ratty? Any question for Dr. Dawes?
Fine, thank you. Of course, Dr. Dawes cannot come here without asking questions. A presentation wouldn't suffice. But anyway, Dr. Dawes, good evening, sir. Let me start by joining my colleagues in welcoming you to what we've dubbed the People's Conference. As you know, there is a conference going on in Montego Bay as we speak, and we've dubbed that a business conference because it's about selling products, services, and investments. Very little to do with the trials and the tribulations of the people of Jamaica as they suffer and they mourn and they die, especially when we talk about the health sector. So let me welcome you again. And in that vein, just yesterday, they had their plenary session on health issues, healthcare, health system. And, you know, when I look at it, I'm disheartened. Disheartened based on what I've heard coming from you, but also what I've read and what I've heard from others. One of the most disappointing and depressing things was that the government allowed, and I use allowed loosely, but allowed nurses, trained, experienced nurses to leave Jamaica for greener pastures when they could have done something to keep them at home. And what did the government of Jamaica do after that? It sent out the Minister of Health to go to the United States and elsewhere to recruit those nurses who left. I don't understand that logic. You allow them to leave because of inadequate remuneration, poor working conditions, etc. So they had to leave for greener pastures because you didn't do anything to keep them, and they left, they went, and then you came up with this bright idea, not you, Dr. Dawes, speaking about the government collectively now, but in particular the health ministry, said, you know what, they're gone, we need to go and get them and bring them back. I just don't see how that's work. And for me, that's an example of a colossal failure. If the minister, and I'm not accusing him of a boondoggle trip, but I'm saying if he wanted to go visit relatives and friends, that wasn't the way to do it, if that's what he did. And if he went out sincerely to recruit these people, it's a travesty. But anyway, here is what they talked about yesterday, and we've been talking about the interest and the assistance that could be provided by the diaspora. And you also mentioned that one of the last things you said in your presentation was things are going to get worse if we don't reform the system. Well, yesterday they had a session, and it was entitled, they didn't use the word reform, they used the word transform. It said, transforming Jamaica's health system in partnership with the diaspora. Goes on to say that they're engaging healthcare professionals, policymakers, diaspora representatives, and community advocates. This session delves into innovative approaches, technology integration, and capacity building initiatives to address healthcare challenges and promote wellness for all Jamaicans. The session aims to catalyze partnerships, knowledge sharing, and actionable recommendations that leverage diaspora expertise, resources, and networks to strengthen Jamaica's health system, improve access to quality care, and advance public health priorities in alignment with national goals and global standards. Sounds good. But for the person who's waiting to get that test, that screening, that thing that you mentioned, this means absolutely nothing. Further, this goes on every 2 years. Every 2 years when they have the biennial, they come up with these fancy words, these fancy phrases, these fancy speeches with these fancy people. And at the end of the day, there's no trickling down. All of these are pie in the sky, wishes. I wouldn't even use the word aspirations, because aspirations suggest that you have intent. And I submit to you that these people, there is no intent here to help the poor people of Jamaica. None. So the question I have for you is, how do you see this playing out? Because you mentioned about the diaspora getting involved and how you would plan to incorporate diaspora assistance in the priority of healthcare. But in light of what's going on here, how do you see the plan that's been proposed? Well, again, year after year after year after year, and I think I'm piggybacking on Jeffrey's question, and I think Prezi also asked you the question. This has been said time and time again. How do you break away from this cycle with the diaspora? How do you break away from the cycle of going to a meeting, saying the right things, and doing nothing? That's my question.
And that's a very good question, a difficult one. I shouldn't say a difficult one. It's easy to understand. It is to actually take tangible steps. And we went through one of the steps, one of the issues already, which is donations. How can we make it easier to donate? The other thing that we can fix is we know that. So no matter what all of the fancy jargon that they're using, technology, partnerships, all of that stuff, at the end of the day, we have to tick a couple of boxes. Whatever you're proposing, partnerships with the diaspora, how is it going to help cancer screening? Because it's easier to screen cancer than to treat cancer. So it gets a precancerous lesions or so on, and then you address them. So what exactly are they going to be doing for that? And sadly, they probably will not be able to give you specifics. Every year, we get hundreds of medical missions coming to Jamaica. In many instances, they give a lot of feedback about how difficult it is to bring supplies in. Again, waivers, they have to pay duties, how difficult it is to coordinate on the ground without people here. But then because these charities are run by volunteers, they don't have all of the money to have a system here in Jamaica. And not many people will take up that responsibility to coordinate for charities overseas. So what you'll have is maybe churches or community groups helping medical missions. There is no coordination between the Ministry of Health to make sure that everybody gets their equipment. We can give some incentives for doctors who are not even Jamaicans to come in and add to the clinics that are being, whether it's dental clinic, whether it's screening. I had a very disturbing conversation with a Jamaican who took his, they were doing capacity building in Egypt and Rwanda for transplants. This is a Jamaican who is teaching in Egypt and Rwanda how to do transplants, how to set up transplant programs. We don't have a transplant program in Jamaica. Every time we do a kidney transplant, it makes the news. This is how rare it is. And when you talk about not building on past successes, we were the first country in the Caribbean under Lawson Douglas to do a kidney transplant. But from then till now, 50 odd years later, we still don't have a proper program in place. Now, someone like that who is frustrated with trying to get a transplant program done in Jamaica and having to go all the way to Africa where they're finding success with Black people again, so you can't talk about it being cultural differences and so on. I hear Africa, they even love meetings more than we do here in Jamaica, but they were able to get this done, and it's replicated in more than one country, not Egypt, Ethiopia, I believe it was. So how do we make it easier for people who want to come back and train and help to set up services that we don't have, how to set up screening? We spoke about colonoscopies. How can we get people to go overseas to get whether formal or informal fellowships? It could simply be observerships with Jamaicans in public and private sector in the US to get some training on colonoscopies, which we know is going to change the landscape of colon cancer treatment. How do we facilitate teleradiology now in terms of making it easier to credential in Jamaican based, US-based Jamaican radiologists, so that they can volunteer to read the mammograms that are being done, the CT scans that are being done in the public sector. Or even if it's a nominal fee, you know, we can do something like that. So we have to look at programs to connect the diaspora. I mean, we have, if you look at Jamaica as a whole, we're 6 million people. You can't just say we have 3 million or 2.9 in Jamaica and say we have one of the largest diasporas in the world. We need to tap into that. It cannot be that we're just talking about diaspora for remittances. We think that it is enough. It is good to get nurses to come back to help with operating theater lists. Why not set up particular hospitals where missions can come in and they can do their cataract surgeries, they can do the dental, they can knock off hernias, and it's easier. But what you have on the ground is a clinic staffed by Ministry of Health, paid doctors and nurses, who are going to make sure that all of the blood pressures are controlled, the sugars are controlled, the patients are properly worked up, so that when you come and they have a list of 15 people, only 3 get done because everybody else canceled because of high blood pressure and diabetes and so on. I remember when we had a mission in Sav, we had a gentleman who came all the way from St. Thomas to have his hernia done. And we had to be doing all of these tests there. He got his hernia done, but could we find him to follow up? Thank God, everything went well. He didn't get any infection or any complications from surgery. But there is a need, and if we put systems in place to facilitate people coming in and giving back the way they want to, that is how it is going to work. It's not through fancy jargon. It's what is happening exists already. It just needs to be formalized and streamlined, and it's amazing how far that reach would be. You know, you have people going into communities up high up in the hills where nobody really cares about them, but they were one who escaped poverty and they got a life in the US or the UK, Canada, wherever it is, and they want to give back, so they're the only ones who care for that particular area. So when they're donating, if they want to earmark that donation for that area, don't say that you can't do that. It has to go elsewhere. If they want to have a mission going there, find out what they want to do. If it is that they're going to be screening, then allow the screening tools to come in without any duty, allow transportation, incentivize the locals to participate, you know, do some health promotion locally to make sure that they have a good turnout with that, because that little money that you're spending or you're giving up in customs fees is going to be more than matched by the value of the services and what you're going to prevent in the long term by picking up an early cancer, picking up some people with diabetes and high blood pressure and ensuring that they're treated so they don't get a stroke. So again, it comes back down to priorities. You don't have to reinvent the wheel. You just have to streamline, regularize, and get some accountability in.
Thank you, Doctor. Ladies and gentlemen, if you're just joining us, welcome to day number 4 of the Global Jamaica Diaspora Conference. Will, I think you have a follow-up, and then we go to Herb Nelson.
Yes. Now, Doc, one of the things that we have seen wholesale in Jamaica is the concept and the practice of putting square pegs in round holes, or trying to fit square pegs in round holes, and we know that's not going to work. What do I mean by that? Presently we have a medical doctor who is Minister of National Security. I'll just give you that one example. I'm sure you're aware of all the other examples of misfits. And when I say misfits, not that they're not qualified, but they're not qualified for the job that they're presently assigned to. In your case, assuming that the opposition is victorious in the next general election, it's likely that you will become the new and the next Minister of Health and Wellness. And that would be a square peg in a square hole. It would be a perfect fit. Now, the question I have for you has to do with administration, because in that position, I doubt very much that you'd be able to be involved in surgeries. So more or less, you'd be more like an administrator to make sure that things are running properly. But given your medical training, you would know when things are running properly or not, as opposed to the gentleman that we have now who has a PhD in marketing and is involved in marketing other things besides getting the work done. So how do you plan to do that? Because you would end up with a permanent secretary who's in charge of essentially the day-to-day operations, and is already involved in a certain pattern and practice with this minister. How do you see yourself working with that permanent secretary to get things done, considering that you would no longer be, or it would be less likely that you would continue to practice the way you're practicing medicine right now?
Well, the permanent secretary and the administrative staff of the Ministry of Health, they are tasked with the implementation of policies and priority areas. So I wouldn't necessarily have to be hands-on. What a lot of doctors, nurses, retired Ministry of Health officials, persons who have been in the system for years are saying to me is that I give them hope that as someone who knows what it's like on the ground, in the trenches, they're hoping that I can bring that level of experience to know what needs to be prioritized. Meaning that if we're talking about obesity, a lot of time, energy, and money has been spent on Jamaica Moves, telling people that they need to exercise more. I'm a weight loss doctor, a bariatric surgeon, and I have a wealth of experience with Jamaicans who have tried everything to lose weight until they come to me to do surgery. For one, we have to develop bariatric surgery in Jamaica. There are some people who just can't lose it on their own, and they have health complications. So you prioritize the development, the training, development, and resourcing of facilities for that. You develop nutritional program, not to have TV ads and billboards like what you see right across Jamaica right now, but you start by empowering, and you do this in collaboration with the Ministry of Education. Nutritional education. Children need to learn how to read a nutrition label, and they need to go home and teach their parents. I'm giving away a manifesto item here now, but instead of having these road shows where you're spending millions of dollars on production costs to go to a particular town and dance and tell people that they need to move around and eat right and exercise, what you would do is to, in collaboration with the Ministry of Sports, Ministry of Local Development, you create safe spaces, parks, and you put in, you would see it in the US, I see a lot of them in Cuba and South America, outdoor gyms where people can go and they do their cycling, or they do like, their treadmills. And these are based on metal. So it's hard for them to move unless you're really determined. But you create these in the communities. You create football leagues, you get kids outside. And this is, when you do this, that money that you spend to empower those coaches, community leaders, and so on, who are all about the green spaces and getting people to go outside of their house more. Stress goes down, fitness goes up, a health conscious environment leads to healthier decisions over time. You change completely people's lifestyles, but you have a greater impact at that grassroots level. I wouldn't necessarily need to do that implementation, but you can say, hey, this is what is going to be in the budget for these programs. We're not going to put up 1,000 billboards. We're only going to put up 200. And the money that we save is going to go towards developing football programs, netball programs, or we're going to use that to develop exercise equipment for parks to be placed in different communities. Or we're going to, in collaboration with local government and sports, have snacks and juice and so on for the kids for a year whenever they play sports in their communities. And then you're like, all right, Mr. Permanent Secretary, CMO, policy unit, whoever it is who needs to implement, this is where we're going to go. But if you go into the ministry and you don't have an idea of where the technocrats should be working, then they're just going to continue implementing what was left over from the previous administration. So we, and I say we because I am working with a team that some are retired, some have left out of frustration, some are still there but quiet and still frustrated, but they have all of these completed or at various stages of completion plans that if implemented, they would go a long way to addressing some of the issues that we have in the health sector. So the plans are there. It's really to have someone to say, we're going to do it this way, but priorities change depending on who's the minister, which is why reshuffling will work to, to change the nature of a ministry. But as I said, and I have to be continually humbled by it, that it really was a leap of faith for the party leader to, as somebody told me the other day, based on all of the chaos that has followed me coming into politics, I was an expensive buy. But I have to, be humbled by the faith that they have placed in me to say that I can look at the big picture based on where I am, having seen everything at different levels through different seats, coming up from an intern to a junior resident to a registrar to head of a hospital, as a union leader, batting for doctors' rights and working closely with the nurses union, labs, etc., to, in the private sector, seeing what exists in the private sector versus what's in the public sector. I'm hoping that with the guidance that I'm getting from my team, we can revolutionize healthcare in Jamaica.
Mm-hmm.
Let me just say, begging Mr. President's indulgence, and also my dear brother and colleague, Herb Nelson, his indulgence as well. You said something that I just want to ask you a question, and I'll forego asking a question in the second round. I just gave it away. You just gave away a manifesto point. I just gave away a strategic point here because we know we're going to have a second round. But listen, given the frustration, the deficiencies, and the challenges in and within the system, what keeps you up at night? No. And would the same things that are keeping you, if anything is keeping you up at night, no, would those same things keep you up at night when you become Minister of Education? Thank you, sir.
Minister of Health. Minister of Health.
What will keep
Stand corrected, Minister of Health.
What will keep me up at night and what is keeping me up now is the fact that you cannot change the system in 100 days like what they love to measure, whether they will stick to it or not when they get into office. And you still will have people dying for lack of attention, for lack of resources, availability of diagnostics, etc. People will still die for a while until we get it right. And that is what I fear, because when you I remember one time I lost a patient. I think it was the first patient I'd lost when it was solely me. It wasn't part of a team. I was the only doctor they had and the only surgeon, and operated on them. And I lost that patient, and it was full-blown grief. And I met an old surgeon, and he said that, well, no, you're learning that the day when you don't feel this amount of pain when you lose a patient, that is the day you need to retire. And every time a surgeon, or every time you go through it, when I am in that seat and I'm presiding over the entire healthcare sector, every patient is automatically my personal patient. And I will have to learn now or I'll have to come to terms that I inherited a system that will not allow flip of a switch to immediately begin saving lives. And it's going to take some time. And while that is happening, people are still going to be losing their loved ones until the reforms take root. That is what I'm concerned about.
Yes, Dr. Dawes, Herb Nelson, apologize, got a bunch of issues with my system tonight, but I'm glad to be here. I appreciate you being here for us as well. And greetings to the audience as well. Doc, you are talking about the reaction of the community when it comes to health and fitness. 2016, we introduced a program called Safer Cities because of smarter communities. And during that time frame, the very program we introduced was turned down by Dr. Chang. And we told him that the program could work wonders for communities. For instance, FIFA and the FIFA Foundation has a program that they'll approve football stadiums for every town and every city that requests it and fill out the requests in a timely manner, get it endorsed by the National Football Federation, and send it in. So can you imagine a lot of the European countries, every town, every city has a football stadium. That's where people meet and greet each other Saturday and Sunday. Because I spent 5 years in Europe and I got accustomed to that system. And as a matter of fact, the fitness level was adapted by people 5 to 85. That's the what's out there, very active and on the football field. Now, if you were to look at the US and the training of different people, what concerns me in Jamaica and what has been a shortcoming in Jamaica is the absence of paramedics, or let's say the fire department fully equipped to include ambulances and paramedics. Now, in the US military, Army, Air Force, Marine Corps, there are tens of thousands of Jamaicans who have passed through the system. Quite a few of them are paramedics or EMT3s, so to speak. They have combat training that restores the life of our military in the field. And they are excellent trainers. But let me ask you this. Would you consider a program that could encourage a lot of those people to come back to Jamaica and to participate in a buildup of an EMT or paramedic corps that could then serve in each of the 14 parishes, I should say 13 because Kingston and St. Andrews together, but they could serve a vital purpose in saving lives. The other thing that is in conjunction with that is that the U.S. military has closed down a lot of hospitals. And we know the ventilators are probably sitting on a shelf someplace. So it's a matter of requesting from DOD at the U.S. Embassy in Jamaica that they survey each service for excess ventilators and to see how much can be contributed to the island of Jamaica. What say you?
Well, that really is useful information, and I know that somewhere up in the ranks of those VA hospitals and so on, you have Jamaicans who have the wherewithal to pull the strings to get those donations. Definitely something that would be welcome. You know, well, I don't know if I'd said it here or it was the program before I was on, that sometimes it's not necessarily an ICU space or a high dependency unit that you need in a particular institution. Sometimes you just need a ventilator where you can set up something temporarily until you find that ICU space. And that 24, 48 hours, those are golden hours that determine the difference between life and death. If you don't have that ventilator there, then the patient is going to die. And then you can tell your relatives, oh, there was no ICU space for us to transfer them out to. But the truth is that we have saved a lot of lives by keeping them on the patients on the operating theater ventilators, the anesthetic machines, until we can get them to an ICU. Emergency services, we got some ambulances donated from, I think it was Japan. I can't remember which country, but that program was never really maintained. I remember we got a donation for some radios. My idea was to put them in the ambulances at the fire brigade and have one at South Hospital, so that you could radio ahead and let the doctors know what you're coming in with, so they can clear the trauma room and have the necessary specialties on standby, etc. I got that from the Bahamas, where I did the majority of my surgical residency, and that in turn was imported by a Bahamian who studied at Wayne State University, Detroit Receiving Hospital. So they took that trauma system from Detroit Receiving Hospital, one of the biggest trauma centers in the US, tailor fitted it to a Nassau hospital in the Bahamas, and they set up a whole trauma system around that. So I took that and tried to implement it at Sav Hospital. Yes, I was able to get the trauma bay. Yes, I was able to get people to work in the trauma bay and so on, up to when I was leaving. But we actually got the radios, but could not have the local government, who was responsible for the EMT, for the fire brigade, to fit in with that plan. And so I don't even know where the radios are right now. You know, some donor is going to say that they gave radios and nothing came of it. But that's a dream that I tried to implement because I've seen it work. And I know that as a surgeon, you get a call to say that, hey, you have a gunshot coming into the chest. We know that we're going to be prepping for a chest tube. And once you put in a chest tube, that is going to make a difference between life and death. You're going to know whether or not you can take them up to theater same time, or, you know, we can downscale them to the regular emergency department and free up the trauma bay because you get another call of another ambulance coming in. So EMT services are an integral part of the trauma system that I would love to see set up in Jamaica. And I've actually, well, at one point, you know, I'd wanted to become a trauma surgeon because I loved it so much during training. And one of the courses that I had done at the American College of Surgeons annual Congress was actually based on the setup of trauma systems. So it is something that the blueprint is there already. Other countries, Bahamas, they have you know, set it up. It's just a matter of putting it in our lower resourced environment. But we do have the expertise out there in the diaspora who can deal with the actual nitty-gritty of the implementation. I would need to know how you train the EMTs. I would need to know what level of equipment would need to be on the ambulances if we're retrofitting buses to you and minivans to use as ambulances. I wouldn't necessarily know how to do all of that. But there are people who know how to do it. And the policy decision that I would have to make is to say, hey, we're going to do this. So are you guys coming to assist us? this is how we want you to assist us. We can't pay you, but at least you will be put up in a hotel or Airbnb and whatever. And these are the conference center days. These are all the people who are going to be training. Let us make it happen. We need you to draft this plan for the service maintenance. We need a checklist for what needs to be put into all of these ambulances and so on. So that is how you develop that, rather than we have this incestuous behavior where, people tend to hold on to projects for themselves and don't want anybody from the outside to come and show them up in inverted commas. A lot of one-eyed kings want to protect their kingdoms.
True.
Urban, any follow-up?
Just one follow-up. Imagine now, I've talked to Mayor of Montego Bay, I've talked to Babatunde in St. Thomas and Kingston, and some others who are trying to get the FIFA program approved. Imagine if we can get at least, say, half a dozen stadiums approved by FIFA in strategic border positions between the 14 parishes. And you have the ambulance services that's attached to those stadiums. That is part of a concept of safer cities that would complete it. In other words, the fire department wouldn't have those EMTs, or they could supervise overall, right? And once you have somebody who's a head paramedic or head EMT, and you're supervising overall, and you set this up, the idea of having those stadiums in strategic locations would then give you a more complete 360 approach to the fitness that you seek and fitness programs, as well as the emergency medical services that you also seek. So, I mean, it's food for thought. And if you said that in a different government that's an idea you could take and run with it, it could resolve a lot of issues for Jamaica, because FIFA Foundation has billions of dollars, and they're going to earn billions more in 2026 when the World Cup comes back to the US, because the foundation was started after the foundation had accumulated $11 billion from the 1994 US World Cup. And it's coming back. So they're going to make a ton of money this time in the US. And so they have the money, but people have to take the time out to request the stadiums. And along with the stadiums comes long-term services, which would include what we're talking about now, and other type services like meeting rooms, support to other organizations that could link to the stadiums being used as a training area. So, I appreciate it, Doc. Thank you.
I can't believe that such a program is available. I mean, in my constituency alone, I can think of 4 areas. I mean, in one of them, they started to build a stadium and then it just stopped. Another one, there's this massive dust bowl that, they have tried for years to do something about it. I can't believe that there's just money available.
It is.
That we definitely need to keep in touch to see how we could do something like that, because I'm very interested in that.
Okay. Thank you. Will do, Doc. Get you information from
Dr. Dawes. Thank you so much for all that you've been doing. My question for you: do you have a few more minutes with us? We can open the phone lines and have our viewers call in. How you stay with time?
Time is tight, but I think I can take a few. But I'd probably have to wrap up shortly. See, that press conference today. It really started a firestorm. So I have a couple of interviews and so on to do, and a couple of people to speak with to get some updates.
All right. Thank you so much for your indulgence. Ladies and gentlemen, we're opening the phone lines. You may give us a call at 757-655-3377. That's 757-655-3377 if you'd like to talk to Dr. Dawes. Dr. Dawes, today on the program, you were being interviewed on the ventilators. I really want to go back to that, because when people are losing family members as a result of something as simple as a ventilator that was donated that should be readily available for use, how do you plan to do inventory management in your portfolio capacity as the next Minister of Health? Just say the tides turn your way, and then we are going to go to a call. How would you handle inventory management?
It's there already. The inventory systems are there. You just need accountability, because when distributed, everything gets a serial number and it tells you exactly where they are. When we're in a hospital, the assets are there, and you have a hospital administrator who is responsible for asset management, and they are supposed to be able to tell you what it is that's there, what it is that's functioning, what it is that's not, what is maintenance department saying. But when they get their reports, does it stay at that level? And there is never any vertical integration between the keepers of the record at the Ministry of Health and those on the ground. All that needs to happen is that you have to have accountability, because everything is there. When that tourist posted that video asking for toilet paper, and the nurse was saying that there was no toilet paper, yet right after that, there was a picture posted with a warehouse full of toilet paper to say that there's no shortage of toilet paper in the Western region. All of that is accounted for in the warehouse, and the lack of tissues was documented in the hospital. The failure was of that inventory management system to have proper reorder points and to ensure that enough supplies were given to last until the next reorder point. If utilization goes up, then you increase. If it goes down, then you decrease. And you have buffer stock. You have to have buffer stock. So this is not something that is not. There's nothing new to implement. It is just to make sure that there's accountability. If we're moving to electronic health records, then we're going to have built-in inventory software. But it's not hard. Everything exists out there now, some of them free.
In my capacity, I run an IT firm here in South Florida, and I work with many practices and have great relationship with large hospital networks. And it's very easy. And sometimes you wonder, what? It's just a software. It's just a software. And you're making it seem as if it's rocket science. Nonetheless, we have a caller on the line. Caller, you're live with Dr. Alfred Dawes. What's your question for him?
Good night, panel and Dr. Dawes. And I thank you very much, sir, for the hard work that you're doing. My question is, can you provide, based on the physical capacity of each hospital, how many beds will be able to sit in each hospital, so that later on, when the opposition party takes over, one of the things that we can know in diaspora is how many beds can we contribute to a particular hospital that might be able to have the capacity to hold that amount of beds. And another thing is that how will you work along with the schools in terms of school nurse in each and every school? Thank you, sir.
All right, caller, thank you so much. Dr. Dawes, caller will take the next off here.
Sure. So that information already exists in terms of the number of beds. The problem is that you may have beds occupying all of the available bed spaces, but what needs to happen is that you need to push more and more beds into corridors. So what happens is that you're filling up all of the available bed spaces with beds that you have, but the shortage of beds is that you don't have anywhere to put additional beds because the hospitals are physically too small, or they're just overcrowded. So we have to look at why it is that people are staying in the hospitals too long, and why is it that we have such an increase in hospitalizations. So it's good to look at the number of beds, but we have to look at bed management, and that will go a long way. And this is where my friend, who is a case manager, pointed out how case management and bed management works in these developed private health systems in the US. With respect to school nurses, not every school should really and truly have a school nurse. And that is where a part of this whole nutrition education will come in, because you have to teach kids basic nutrition, and you have to teach them first aid, what to look out for. You know, sometimes it's a kid who is going to notice that their grandmother is having a stroke because of the slurred speech, etc. You know, they must know first aid because of injuries, etc. And what you're doing is empowering them so that later on they have more conscious health-seeking behavior as they grow up.
Thank you, Dr. Dawes. We have another caller. Caller, go ahead. You're live with Dr. Dawes.
Hi, Dr. Dawes. Very fruitful conversation. Thank you so much for being on this conference. I have sort of kind of two questions for you. How would you navigate if you are elected the next Ministry of Health? One, the conflict of interest of practitioners or the subcontracting, I should say, of medical services such as labs or pharmacy, where medical facilities are out of medications. I know Andre had spoken about one earlier where some medications are being stored in a chest of drawers. So I remember you talking about earlier just now about the checks and balances, or how things are, we know what the quantity is of certain stocks that are within the system, and I doubt that is accurate. But how would you navigate or change the culture or change the conflict of interest of practitioners owning these labs, owning these pharmacies, and the hospital system is sending individuals to these labs to get these tests done and to take them back to the hospitals? And two, the medical supplies such as the toilet tissue and among other things, born, bred, and raised in Jamaica for years, and I've known everybody going to the hospital have to carry the base and the toilet paper, the blankets, and everything. So the supplies is not being used by the patients, but the people who work at the hospital. How do you change that?
Thank you, caller, for your question. Dr. Dawes.
Right. And that's a good question. So the conflict of interest goes beyond just sending people to labs. It goes to even the purchase of instrumentation for surgeries. And it's something that's difficult to pinpoint because many people have frontmen running it, but it has reached a stage now where you have other doctors are saying, you know, why is it that one particular company is getting all of the contracts to supply disposables and medical equipment, and it is on the insistence of a particular member of staff or somebody in management positions. So it is something that is an issue. It's uncompetitive. And what it leads to is that everybody will throw up their hands and say the system is corrupt, so they're not going to pull their weight as much as possible. That is one extreme. The other extreme is that you still have doctors who are sneaking in private patients without having those patients pay their that minimal contribution that would go a long way towards at least some basic services in the hospitals. So overall, we'll have to weed out instances where people don't declare their hands, but in many instances, it goes far beyond just a one person sending them to a particular pharmacy or lab. It's on a much larger scale than you would imagine. Kickbacks are real, and like I said it, you really draw me up, but I said it, and I suspect you would have been reading between the lines, where I said that the broken system benefits some people, and we have to get the buy-in of the majority of people to say that we have to fix healthcare, and it can't be business as usual, and you blame everybody else that the system is broken when you are profiting or benefiting from that system. With respect to outsourcing, one of the policy papers that we'll be looking at is a national health insurance scheme. Of course, this would not be financed by any new taxes. Let me just state that clear for the record. But we think that if we clear up some wastage and we expand the functions of the National Health Fund, where it was initially conceptualized to be the first pillar in a national health insurance scheme, and it was supposed to take care of drugs and then later on move on. It does take care of some drugs, and we're seeing where it's being expanded into screening. We're still fleshing out the details with respect to that. But what it would look like is that if private sector is partnering with government, it would be on the government's terms. We're giving you more volume in exchange for a lower than market rate price, as opposed to what obtains now, where we're just sending out people and they're charging them whatever they want. And then what is happening is that that system gets corrupted, and you have people from private institutions giving kickbacks to people who send from the public health system, who send them to that facility. So it's a, like I said, it's going to take a while before the system is fixed, but there's so many, and I won't say low-hanging fruit. There are so many fruits within reach, within stretch, that you can fix, that we would start seeing results fairly quickly.
Thank you, Dr. Dawes. Our final question from a caller, then the panelists will go ahead and we'll ask you your final question, so we're free up to go do some other interviews. Caller, you're live with Dr. Alfred Dawes.
Yeah, hi, Dr. Dawes. Good evening. Thank you for your participation. Hello to the panel. Regarding the broader issue of national health maintenance, kind of a two-part question. Do you see a role for the Jamaican farmers? And if you do, how would you integrate with the Ministry of Agriculture the need for those farmers to provide the necessary nutrition toward meeting the goal of national health, generally speaking? How do you see the farmers, the role that the farmers need to play? Because I really think that it's quite important, very paramount, that in order to maintain proper health, we need to learn to feed ourselves instead of taking, all this imported stuff from God knows where. We need to learn to feed ourselves. How do you see the role of the farmers in Jamaica playing in this space?
Right.
Take your off here, Dr. Dawes.
Right. So when we tell patients they need to eat healthier, one of the first thing they'll tell you is that eating healthy is expensive. And that's because we have been cultured to think that eating healthy, based on TV and influencers on social media, is eating chicken breast and salmon and broccoli and kale. I remind them that pumpkin and chocho and callaloo is $200-300 a bundle. Bananas, tomatoes fluctuate so much in prices. All of these are healthy foods, but because we're importing the definition of healthy foods from more developed countries, it is their fruits and vegetables that we are looking at. So with that, we really need to promote healthy local substitutes. We eat a lot of rice in Jamaica, and we need to go back to more grown provisions. The sweet potatoes, the yam, cassava, bananas, all of these have to be developed we have to develop a local market for them. And how we do that is to drive consumption by advertising them as healthy alternatives. Breadfruit, people complain that ackee gives you prostate cancer. That's just not true. Then I tell you that ackee is all fat, but it is monounsaturated fat. It's an excellent source of monounsaturated fat. Goat is one of the best sources of protein because it is so lean. Our chickens are not pumped full of antibiotics and hormones like with the imported chicken parts. When you're talking about developing local industry, you have to look at how are you going to limit the importation of cheaper, unhealthier substitutes. The number one protein for Jamaica is chicken back. Chicken back is the worst part of the chicken with respect to the highest fat content and the lowest protein content. And yet this is what we import the most. We import a lot of pork from time to time, and that farmers complain about that. And then you look at the fruits. We're importing everything, but you have to look at who is really benefiting from all of these importations of those fruits, as opposed to trying to encourage Jamaicans to eat more local fruits, which are more nutritious. Our fruits are not bred for long shelf lives. They're bred because they're sweet, or they're nice, or they're juicy, fleshy, as opposed to those that are bred for transiting in shipping containers and for staying on your Walmart shelves for a while. So, I don't want to go over into other portfolio responsibilities, but an integral part, as I said, we're an aging population with an expanding waistline, obesity rates going up, diabetic rates are going up, hypertensive rates are going up. We know that all of this starts with the diet. We can't tell people to become less sedentary because they're still going to be, we'll hear stories about our grandparents walking to school, walking to work, walking to bus stop, and so on. As people get more urbanized, you're waking up, you're going into a vehicle, you go to work, you stay at work at your desk most of the time. You don't even need to leave to go on the road to walk to get lunch. There are elevators and so on. So what you're calling non-exercise thermogenesis activity, that is extremely low. So you're not burning a lot. And unless you're somebody who fidgets, your caloric requirements are going to be less. So we need to tell people to eat less, because we can't tell them to move around more, because our developed urban environment is not going to allow them that. And if they're stuck in traffic, like in Portmore, people have to wake up early in the morning so that they can beat the traffic to get their kids to school and then go to work. And then they're stuck in traffic in the evenings, reaching home after 7. and they just have to grab whatever they can and eat and go to sleep and start the whole process over again. It's hard to tell them to squeeze in some exercise. So it starts with diet. Anything exercise is brought up. So education in conjunction with empowering farmers and developing the market for local produce is going to make we're going to go a long way, make a major difference in terms of our health.
All right, thank you, Doctor. All right, gentlemen, the panel. Okay, so gentlemen, listen, we each have one question. We do not have a follow-up. We gotta let Dr. Dawes go.
If I could go, but quick questions, I guess.
Yeah. So please, guys, quick questions, no follow-up. And Doc, feel free to literally just like take 2 questions and answer the 2 in 1. So feel free. If it's an easy question, like 1, 2, 3, that I'll knock that out to the next one. So feel free to do that.
May I?
So we're gonna go with Jeffrey Tavares first. Jeffrey, question for Dr.
Dr. Dawes, if you become the next Minister of Health, how many hospitals do you plan to build in Jamaica?
The first hospital I'm going to build in Jamaica is one in Portmore, because I believe that if you build a hospital in Portmore, in the heart of the largest development of housing development in the English-speaking Caribbean, if talking about Bernard Lodge, Old Harbour, all of the Hellshaw, Greater Portmore, all of those developments, you need a hospital, because there are a lot of young families there, a lot of elderly people have been living for quite some time. If I was going to build any hospital, that is the first place I would build one. You immediately put in maternity and childcare services. You take the burden off Spanish Town Hospital, Victoria Jubilee, and Bustamante Hospital. When you do that, if you have emergency services, then you take the burden off Spanish Town Hospital. So you have Spanish Town Hospital now focusing more on the trauma that's going to come off of the highway, and then it can become a referral center, because then you would be able to do more advanced care, seeing that you have less accident and emergency, less maternal, less child health issues. But what I would do is expand ward space in other hospitals and renovate theaters.
And build one in Negril?
Negril.
That's a follow-up, Jeffrey.
Sorry.
Negril, I would build up some hospital, but upgrade the Negril Health Center.
Thank you, Doc. Herb, your question.
Yeah, Doc. As I had suggested earlier, querying the military group, which is controlled by the Navy, U.S. Navy, at the U.S. Embassy in Kingston, might be a good idea, just to see, because they can cover government, period. All of government. They can cover the military, they can cover the VA, and they can cover the public health services. And just the GSA handles excess equipment, General Services Administration. So they could help in that query to bring to Jamaica a lot of equipment, including dialysis machines, from a lot of the military hospitals that have been closing down. So, I mean, that's just a suggestion, a starting point. And then if we need to get involved in the diaspora to make it happen, then by all means, let us know. But if Jamaica expresses it, the diaspora can follow up. Thank you for being here this evening.
The day after elections, I'll make sure to reach out to you to start that process.
All right.
Indeed.
Not a problem.
Dr. Dawes, thank you very much for a wonderful presentation. Are you aware that we have hundreds of medical missions that come to Jamaica every year? They're not coordinated, and all of the problems you're talking about could have been resolved by them. And why it has not been, I don't know. I hope you understand what you have to do next.
Indeed. I referenced it earlier before. We have to ensure that it is easier to have a medical mission in Jamaica. And if it means that you're having a medical mission unit at the Ministry of Health to coordinate everything from import permits and underground, facilitation, marketing, etc., then that's something that definitely has to be done. But I see it's much cheaper for the Ministry of Health to facilitate these missions, especially if you're looking at screening and preventative diseases, than to deploy staff full-time into many of the clinics and areas. So it's a win-win for everybody.
Good shot.
Well,
Yes, Dr. Dawes, I have one question. I'm going to follow protocol. But however, I just have to mention some issues that people raise. You don't have to answer them, but just keep them in the back of your mind. One is, how do you dispose of biohazard waste? Because that's a problem. Second one is, there are a few listeners said that, and supporters said that they would like to hear you talk more about women's issues. And three, August 23rd of last year, the Minister of Foreign Affairs and Foreign Trade announced that the government of Japan gave Jamaica enough money for some vehicles, including 5 new ambulances. And I remember you had mentioned something about ambulances a while ago. We don't know where those ambulances are. We don't even know where the money is. But here is something that the question I want to ask you relates to this. Talking about ambulances, I'll read you something very, very quickly. It says, emergency services and hospital care vary throughout the island, and response times and quality of care may vary from U.S. standards. Public hospitals are under-resourced and cannot always provide high-level or specialized care. Private hospitals require payment upfront before admitting patients and may not have the ability to provide specialized care. Ambulance services are not always readily available, especially in rural areas, and are not always staffed by trained personnel. That statement came out in January of this year from the U.S. Embassy. That's an indictment of our healthcare system. Now, here's a question. You mentioned that in light of everything I just mentioned, you also mentioned or indicated that there was the presence of corruption that's greatly, causing a setback in terms of advancing the healthcare system in Jamaica. You also mentioned about kickbacks and preferential treatment in terms of the awarding of contracts. When you are appointed Minister of Health and Wellness, do you plan to establish an initiative with MOCA, the JCF, the Integrity Commission, and others, including foreign partners, to address some of these issues that you just mentioned and that I'm talking about now, corruption, kickbacks, etc.? Do you plan to, what steps do you plan to address this issue?
All right, so you cleverly sneaked in a bunch of questions by not calling them your own, but I'll just quickly run through. Biohazard, as it is right now, it is a disaster in Jamaica because only the facility that has been approved is by the Ministry of Health themselves, and everybody else are basically couriers. That needs to be developed, and we need to privatize or give private facilities the option of dealing with at least private facility medical waste. So that is an entire area of reform. With respect to women's health, I did have some statistics here that are disturbing. But since you asked, we can delve a little bit into it. So our maternal mortality rate has been steadily increasing over the last 8 years, and it's not just due to COVID, because 2019 was higher than 2020, which was when we had COVID here in Jamaica, and 2022 continues to be high. It's actually higher than it was 30 years ago. Significantly related is that our neonatal mortality rate, which is the death of babies under the age of 29 days, that has increased 60% from 2000 to 2021 and is one of the highest in the region. Infant mortality rates have gone up as well, and the under 5 mortality rates of children have gone up. Breast cancer rates are climbing, and we are seeing more advanced breast cancers because of the lack of screening in the public health system in the form of mammograms. Cervical cancer rates are going down, and that has been attributed to screening, but it is still woefully high. It is the second third leading cause of cancer in women, with disease of the uterine cavity, uterus itself. Second, colon cancer overall in terms of cancers in Jamaica, you know, women and men, it's third. And again, it's 2/3 of those cancers are advanced. More women are obese than Jamaican men. However, women are living a little bit longer. So there are a lot of issues surrounding women's health and access to their support systems, etc. A lot of that needs to be developed. Ambulances, we touched on that. It just needs a comprehensive overall. And with respect to that travel advisory, these are things that when we highlighted, we were accused of making political mischief. But I doubt the US would be making political mischief. It is a genuine concern for their citizens. And so we have to we have to keep on the pressure so that they don't try to PR themselves out of it. With respect to this institutional issue of corruption and kickbacks, that is something that has to be addressed on a wholesale level. The same issues I tell people: you drive on the roads, you see the potholes coming after the first raid on a road that has recently been fixed. Why do you think that's only happening in Ministry of Works? Why you don't think that the same thing is happening in Ministry of Health, where we're buying expensive equipment that break down in no time at all? Or we spend billions of dollars on renovations and then roofs leak, bathrooms get mashed up in no time because of the inferior quality. Like, all of these things are systemic problems, whereas we can tighten up on it individually. If we're going to, there are laws that need to be passed, graft laws. In the US, you know, the anti-gang legislations are much stronger. One of the easiest ways we can tackle crime in Jamaica is by strengthening the Proceeds of Crime Act. You know, somebody has a house that their salary can't explain, a car that their salary can't explain, then something needs to be done about that. Remember that Al Capone was never charged and convicted of murder. It was tax evasion. The problem is that if you strengthen Proceeds of Crime Act, the Proceeds of Crime Act in Jamaica, a lot of politicians and their friends are going to go to jail. So that is a wholesale reform, that if that happens, potholes will be less, healthcare will be better, security will be better, we'll have less graft at customs, education will be better. It's something that we collectively have to address. So whereas I can do my part, it's that question is more to my leader, Mark Golin, who I know does have a very strong position on you know, reducing corruption in Jamaica. So I can say that it is going to be a priority based on the position of the party, but it's not just going to be a Ministry of Health solution.
Thank you, Dr. Alfred Dawes. So before you make your final statement, a question, well, not really a question, but a plea from me to you and all the other people in your party, and if you guys are elected. I run a not-for-profit organization here in the United States. And for the last 16 years, well, 17 this year, we've been going to Jamaica. We've donated tens of thousands of back-to-school book bags and hundreds of thousands of books and pencils and many other things, wheelchair walker to many different organizations. And every year, including right now, we have stuff on the wharf as we're speaking, and we have to pay to clear it. I know you addressed that earlier as it relates to working with international partners who are pouring into the community. We've built computer labs. We've this year we're bringing on computers too. But everything, when it hits us with the duty, we have to pay that duty. And secondly, we've applied for a not-for-profit status, or to get tax break, or the import duty-free or reduced duty. And it's so many red tape. What will you do for people like me who want to give back to their country and have been doing it, irrespective of all the challenges and the red tape. What will you do for people like me? And then after your answer, you may do your closing remarks. And thank you for coming on.
Well, this is definitely, as I had mentioned, something that crosses sectors. So what I will immediately do is raise this issue at the next shadow cabinet meeting and see if it will become a part of the manifesto of the PNP, the People's National Party. But
thank you.
To close, I mean, this has been a fulsome discussion. I really did not know when I was invited that I would have been facing such a grilling in terms of the policies, and not just what I plan to do, but how I plan to accomplish these lofty ideas. But I really appreciate it, and it does kind of reinforce a lot of what I believe to be priorities and what are important to Jamaicans. You bringing up those same concerns, and you know, just reading a couple of the texts as well. I realize that what we are discussing here is not something that is abstract or as is put out there mischievous. But these are all genuine shared concerns, and especially coming from people who are seeing what could be Jamaica's healthcare if we just do the right thing. It is encouraging, and I must tell you, thank you for having me and giving me this opportunity to share my thoughts and interacting with such a highly panel and audience. So thank you again.
I'll try and give you a call, Dr. Dawes.
Definitely.
Thank you. Ladies and gentlemen, thank you so much for continuing to be a part of day 4 of the Global Jamaica Diaspora Conference. Now, we have our next guest who ran into some unfortunate delay. We are addressing the issue as we speak, as it relates to his travels. Our guest is in Jamaica and ran into some serious issues as it relates to connectivity, and we cannot bring on the guest at this time. So, being as skilled as we are, we're gonna pivot, right? We will find a substitute. So let me bring on to center stage this handsome young man here as we pivot, because our guest, I think you need to put your phone on do not disturb. Everybody's calling, but nonetheless, our guest ran into some challenges and is unable to make the connection. But we want to open it up to our listeners. We have our panelists still here, and we have our great listeners out there. So, can you just brief the audience on the situation, just so that they'll understand the situation with our panelists who ran into some challenges and couldn't make it from the destination that he is?
Sure. I sincerely apologize on behalf of Ambassador Curtis Ward for his absence here tonight. He made every effort to join us. He's in Jamaica and he's having internet problems. He said at one point the internet was down for 2 hours and it's going in and out, in and out, in and out. So we will have to reschedule him, hopefully before the conference, but definitely after the conference, we will have him come in. He was scheduled to speak about foreign affairs and foreign trade, but particularly the foreign affairs segment. As most of you know, we've had mishaps, and you've heard me describe the motley crew over at the Ministry of Foreign Affairs and Foreign Trade as rank amateurs. I said it, I'm saying it again, and I will continue to stand by it. I know a little bit about foreign affairs by virtue of serving overseas various American embassies I've done temporary or extended service in Europe, the Far East, the Middle East, Africa, and North America, up in Canada. And so I know how this sausage is made, this sausage called foreign affairs. I know how that is made. And based on what I'm seeing coming out of the present cadre of foreign affairs, so-called professionals in Jamaica, woefully inadequate, beneath what we should be doing. And we have become the laughing stock in some circles at the UN and in other international venues and organizations. And so we wanted Ambassador Curtis Ward, who served as the Jamaican ambassador, the Jamaican ambassador to United Nations. And that's where we've been making a lot of gaffes, a lot of mistakes. He's well aware of them. He's uniquely qualified to discuss this topic. And so we miss him. He's not ill. It's just he's having technical difficulties. When I say miss him, some people might misconstrue that to mean that he's under the weather.
Mr. Rattigan, could we call Ambassador Ward?
I've called him several times since we've started over the last 2.5 hours. And I finally just got a message from him saying that the internet is out.
Yeah, so, I know that part of St. Elizabeth Westminster is having a serious internet problem.
Well, Jeffrey, the man tell about the St. Elizabeth.
No. I'm just saying, I know between St. Elizabeth and Westminster have a serious internet problem.
he's in,
I don't know where he is, I'm just saying.
Yeah. All right. Be that as it may. He will join. That's similar to the Swallowfield revelation. Yeah. So we will have him. If not, by the end of this week, then definitely at some point in the near future we're going to have him. So again, Prezi, I apologize on his behalf, but we have a dynamic crew here. So the show must go on, and there is plenty to talk about. So I turn it right back over to you, sir.
All right. Ladies and gentlemen, we're opening the lines. And I see when Doctor was here, I just got off the phone with Dawn, and she was like, I wanted to ask a doctor a question. Listen, you can always ask a question. We have a full panel here. We got Herb, we got Dr. Rupert, we got Jeffrey, and we got Will. And of course, El Presidente inside the Residente. All right. So feel free to give us a jingle. The phone numbers. Our phone is open 757-655-3377. We'll take your call. Now, I was watching something today, Will, at the business conference. And of course, you have to see what they're going on with. Right. And I think this desperate attempt to try to get people from the diaspora to invest. Listen to me, they discuss no real issues that people face. Like literally, all they talk about, and literally the most of what I heard, Will, and the team, was about investment. Like, oh, we're going to offer you this investment. Oh, we're going to do this. You have this investment. Nobody's saying, here's the deal. When they asked Kamina about voting and participating, she said, well, it's a question that has been asked. No solution, nothing. I didn't hear any concrete solution to address these amazing people here in the diaspora. But all they want is a little money that we have. And that's pretty much, it seems as if that they are. And you said it, but I didn't realize it was so bad until you hear it from them yourself. But before you guys respond, let me bring in this first call. Caller, go ahead, you're live. 1 second. Caller.
I think my question tonight is not directly related to health, so to speak. This is more so something that has been really concerning to me over the past, I want to say, a couple months here with the justice system, vibes cartel, all of that stuff that's happening there in Jamaica. Now, my question is, I want to say probably more so for Uncle Herb or Mr. Rattigan, but interestingly enough, and I hope that you guys bear with me here while I try to get my point across. Previously, I know ISAT Buchanan had gotten into some complications when he made some utterances in regards to the DPP. He was made to apologize. I believe he was fined. And there was some, pending things happening in the background in terms of, him practicing. I think it was like a 12-month period. Please correct me if I'm wrong there. But what I'm trying to say at this particular point is, as we see, the DPP has made utterances suggesting that she has, in the past, conducted proceedings when the jury was tainted. Rather. The Vibes Cartel case was not the only instance. I would like to know what is the proposed, punishment. What is going to be done to say we cannot have these types of things happening in the country going forward. It is important that there is some type of reprimand that occurs because the entire world is looking at us like a laughing stock. She went up to England, she, was there in the background during that trial, etc. I just believe that considering everyone is paying attention, everyone's looking on to see how we move forward, there needs to be some precedent set that we cannot continue this way. So I'd like to hear Uncle Herb or Mr. Rattigan's thoughts on this. Just tying the two together, seeing how they put, ISAT under a microscope for his past utterances. Be it as it may, he was wrong, right, for how he conducted himself. How do we go forward as a country, right, when we're making these types of blunders? Thank you so much.
Thank you for your call, caller. Will?
Sure. Yeah, I'll yield to my colleague, the illustrious Herb Nelson. You want to jump on, Herb? Or you want to go?
Unmute, Herb.
Now follow your lead. Go ahead.
Okay. All right. Now, as far as ISAT Buchanan is concerned, our learned friend, brother, colleague, he admitted that he made an error in judgment, the statements he made. And they're seeking to crucify him, even though we have instances where attorneys did far, far worse than that, and they ended up with much, much lighter punishment. So it would appear as if there is something there beyond just the ordinary dispensation of justice for violating the canons. It would appear that way. And we will find out shortly because I believe his appeal has been filed. So we will find out what's going on there. You mentioned the DPP. That is, and you're right, we're looked at as the laughing stock of the Caribbean as far as how we handle that situation, because the government under the cloud of darkness amended the Constitution while the CRC was contemplating its amendments to the Constitution. So it didn't go through the CRC. This was done on under the table type of deal, and it was also done when certain members, to the best of my knowledge, certain members of the opposition, they weren't present in the Senate because you need 2/3 vote there in the Senate, and they didn't have enough. They had, I think, 1 or 2 people missing, and all you need in the Senate to get the 2/3, if you're the government, is 1 person to cross over and vote with the governing party. So that's what they did. And then, as you're aware, young lady, the Court of Appeal, it was appealed, and the Court of Appeal ruled that this DPP was not entitled to for a further extension because she was entitled to only 1 under the old provisions of the Constitution. And they can't amend it now and give her a second bite at the apple. She got her first bite already. When she was 60, and and they extended her for 3 years, so she was supposed to leave at 63. End of story. Now, here is where it gets interesting. For some reason best known to them, the government has decided to appeal that decision, even though it, by all accounts, it's a very sound decision. The government has decided to appeal it, and then you ask yourself the question: why are they in such a hurry? Why are they so, so filled with the effort to get her to stay? She's 63. She finished her term. She should go home. But they want to keep her there. And so it begs the question, why? Why? They have qualified people that could take over that job tomorrow. Why is it that you want to keep her? And keep in mind also that last year, I think it was February, she put in the paperwork for the extension. And in May, the Services Commission wrote her back and said, Madam DPP, no, we're not giving you an extension. And by the way, Madam DPP, the Prime Minister, under advice of Council, decided not to support an extension for you. So in May of last year, she was told by the Services Commission and the Prime Minister that, no, we don't want you. Something happened between May and August, because in August, they passed an amendment to the Constitution, thereby to what they thought was legitimate, giving her another extension. Something happened between May and August. And what I found out was that in June of last year was when the Integrity Commission provided its report, and it said we have people in Parliament that we're looking at for illicit enrichment. Follow the timeline. February, she applied for the extension. Of February of last year, she applied for the extension. May of last year, the Prime Minister and the Services Commission said, we don't want you. June, the following month, the Integrity Commission come out and said, hey, there are some people in Parliament that we're looking at for illicit enrichment. And August, they said, no, we're going to keep her. Big, big, big problem. Now, one of the things that we're doing, two things we're doing regarding that situation. One is we have sent off a letter to the Governor General, to the Prime Minister, and we're asking them to initiate a tribunal under the Constitution to decide and determine whether or not this DPP is fit to continue in her role. Now, the court already ruled that she shouldn't be there, but we're doing this, and here's why we're doing this. In the Vibes Cartel case, as many of you know, she was called into the judge's chambers along with at least 2 defense attorneys that I'm aware of. Why? Because it was alleged that one of the jurors tried to bribe the other jurors. They started out with 12. One was dismissed because her son was in prison with, maybe he still is, with some of the accused, and they approached him. And so everyone go tell him mother, and the mother said, oh, they might, whatever it is. So she said, no, I don't want to be here. So she was excused. So now they have 11. Then one of the 11 is accused of trying to bribe the other 10. But here's the problem. In Jamaica, you can't have a jury with 10. It must be 11 or 12. So if they remove that juror, they would have to start over the trial. So what happened? The defense attorney said, Judge, there is evidence of a tainted jury panel here, and we cannot move forward in the interest of justice. The DPP said, no, just remind them of their oath to just render a verdict based on the evidence, and I will move on. And the judge agreed with the DPP and moved on. That's why we end up with this Vibes Cartel business, and now, that's why it ended up in the Privy Council, and now we're back here. But to make it worse, after the hearing in London, the DPP came back to Jamaica and was interviewed on nationwide radio. And she said it. She said it. She said she has done this before. She said, this is not the first time I've been working with tainted jury panels. I've done this before. And so we said, no, we can't have a DPP who believes that she is above and beyond reproach. No. So we wrote to the Governor General and the Prime Minister, and there's a section in the Constitution calling for a provision that you can initiate regarding the removal of a DPP, where the Prime Minister has to make the recommendation to the Governor General. The Governor General then appoints a tribunal. The tribunal, they conduct the investigation and they come back to the Governor General and they give him a recommendation. Remove her or don't remove her. That's the only way you can remove a legally, constitutionally DPP, the DPP who's sitting there legally and constitution. That's the only way you can remove a DPP under the Constitution, by having the Governor General remove that person through the tribunal, but it has to be initiated by the Prime Minister, right? I hope you understand. It's kind of confusing, but I hope you understand what I'm saying. No, in addition to that, we have the paperwork now that we're going to submit it to the General Legal Council. What is the General Legal Council? It's the governing body of attorneys. They apply the rules to make sure that the attorneys are acting within the confines of the canons. There is a certain set of behaviors that's expected from attorneys. And if you run afoul of those provisions, then the GLC, just like at ISAT then, it's the same group that punished ISAT and seeking to punish him further. Same group. So now we are submitting papers saying that, look, here's a DPP. For all we know, people might be in prison because of what she did with this tainted Jew. We don't know. But it's not kosher with us. So we are saying, here's what we want now. We want the GLC to conduct an investigation and look into this matter. And if it's found that she has and we believe that she has violated about 6 of the canons, 6 or 8, can't remember the number, but we believe that she should be punished. Now, even if a court says, on this appeal, even if the court says, no, she's entitled to remain there. If the GLC says we're going to suspend your license, then she cannot stay there, because you cannot have a DPP without a law license. You can't have a suspended law license and sit down at the office. So we are going at it from both ways regarding the DPP. So I hope people understand that we're not sitting here and we're just commentating on things happening. We're doing that, but we're also taking action. We're also taking action. And it's disheartening and disappointing that you have so many groups in Jamaica and none of them have seen it fit to do the things that we're doing. We take on the challenge. We take on the responsibility of holding people accountable, civil servants, parliamentarians, so on and so on. We take on that mantle of holding them accountable. But we wish, we hope, we pray that some of these, civic-minded groups in Jamaica and others, including parliamentarians, that they would do some of this work as well. We're not shying away from it. We're just saying there's plenty of work to be done to clean up Jamaica, and we are doing our best. So we're asking people to join us in this effort, because that's the only way we're going to succeed. And if we can do this and we live so far, there's no reason why the people who live in Jamaica can't take a stand. There's absolutely no reason. And for those of you who are fearful, should be inspiration. So,
Herb, you want to chime in, or should I go to the next call?
Yeah.
I want to say something when you finish, please.
Yeah, okay. Let me just say this to you. And looking at this DPP, she is well traveled. And she has, let me just put it straightforward, 11 different telecommunication devices. They're talking about cell phones and tablets, 4 different emails, and 29 social media accounts. She has a litany of breaches that I'm sure if she had reported it, they would have been able to plug the holes in all these accounts. because the accounts that are being utilized are out on the dark web. And I'm talking about the fact that she's actively being used out there. DPP at moj.gov.jm, Paula.llewellyn at moj.gov.jm, right? We have also determined that she's using aliases, right? One of them, a dead man from her office by the name of Lichmore. We also looked at a captain at JDF who's now a lieutenant colonel. And we look at somebody else named Smith that has been also known as by her. So if you have somebody operating as the chief legal prosecutor, the chief legal person for prosecution, why would you need all of this cover? Why would you need so many disguises? Why would you need to be utilizing other people's IDs? These are questions that she should be made to answer. And so when you talk about honesty, and when you talk about the fact that she is being used by this government to deter or defer prosecutions from their shortcomings as identified by the Integrity Commission. And she is on standby in case the illicit 6 comes up and the names are on it. This is the only conclusion you can draw, because she doesn't bring anything additional, no more value added to the team. She's an albatross around their necks. And the acting DPP, also an albatross, is controlled by her. So knowing these things and knowing that the government, or the head of government, I should say, is tainted, when are we going to see a prosecution against him for his failure to file his declarations to Integrity Commission? This is the only thing we're waiting on. And it's not going forward, people. Nobody in Jamaica has introduced anything to prosecute this prime minister, or his wife for that matter. So if this DPP were doing her job, something would have gone forward already. And so we see where she's parading, masquerading still as DPP, while her protege is sitting there acting as DPP. I hope somebody is going to ensure that they pay back monies that they're earning or fail to earn based on the outstanding cases that they have not pursued with the higher-ups. Nobody in the high-level position of Prime Minister, Deputy Prime Minister, or Minister of Foreign Affairs has been honestly put under the microscope by her and been prosecuted for any reason. So what else can you expect? Zero, nothing. So something needs to happen, people. Thank you.
All right, Jeffrey, go ahead. Go ahead.
Yes,
Sir.
if I may, the question that the Jamaican people must ask is, why is it that the Minister of Injustice, Delroy Chuck, okay, he's not Minister of Justice, he's the Minister of Injustice, why is it that he's hell-bent in keeping the lady as Director of Public Prosecution for Jamaica? 2, is it that, as what Mr. Rattigan said or Mr. Nelson said, is it that they're keeping her there because the name of the 6th person under investigation? 2, the Jamaican people must ask the Attorney General and the Chief Justice of Jamaica to look up all her cases she have done before and find out if she have dealt with tainted jurors on those cases. And how many Jamaicans are languishing in our prisons because she have used tainted jurors before? How many? Those are the questions that Jamaican people must ask. And we demand answer from the Minister of Justice and those who are in charge. The Jamaican people must stand up now. We cannot continue like this as a nation. As I said on my program a couple of days ago, Jamaica is running down a slippery path and a slippery slope where people are laughing at us. And are we paying 2 Director of Public Prosecution? Are we? Is the Jamaican taxpayers allowed to be paying 2 DPP? The level of corruption stinks more than Riverton Dump. And I will go further. The Minister of Justice must on his resignation. Must resign. In other words, what he's saying, that I don't agree with the Constitutional Court. To hell with the Constitutional Court. She's gonna stay there. We have an acting director, yet she's still there. So we are paying 2 Director of Public Prosecution, obviously. I yield back to Mr. President.
Mr. President.
Doc, you want to chime in? I have a call on the line. You want to get the call and then you guys continue? Let me take the call. He's been holding a while. Caller, thank you for your patience. You're live. Go ahead.
Yes, good evening, gentlemen. Good evening. So I have 2 quick questions. One, I want to know if Jamaica is 92% Africans, Black people, right? I want to know if there has ever been a study by the UE to find out how much of the wealth created in Jamaica through that 92% control. And 2, do you think that a strategy, one strategy that we could use is to reorient our shopping habits in Jamaica to buy from the local Black vendors instead of going to these other ethnic groups that control the economy in Jamaica. You know, we have a lot of Chinese, a lot of East Indians, a lot of Arabics, and Europeans that run the main economy of Jamaica and leaving the Black business class poor. The Black businessman or businesswoman is on the sidewalk with their wares on the street saying they are business people. We know that that's not business, okay? So, if the panel could address those 2 questions for me, I would deeply appreciate it, because I've been asking that question and everybody been dodging that question, because it's really about race and economics, because it's who control the money, call the shots. We know that they control the politician, the people with the money control the politician, and we, as Black people, we are poor. Jamaica 92% Black, but how much of that wealth do we control? If anybody on the panel could answer that question, I would deeply appreciate it. Thank you very much, gentlemen.
Appreciate excellent question. Doc, you are coming in, and then right.
Yeah, let me just answer, gentlemen. We don't thank him for his question. I don't think we understand what it means to control our wealth and our destiny. I think that there are some people who are attuned to the 3-card tricks that are being played by every person who is saying that there's no corruption in Jamaica is indeed corrupt. Corruption is a disease. Corruption is more than a disease, and it is very, very simple. No matter what, if you can't get up and stand up for your average persons in Jamaica, and you're living high on the hog or what have you, there are lots of good people in Jamaica. But to be quite honest with you, some people don't understand what it is to be a real Jamaican. I know, yes, you say that people like me, we've run away and we have come to the United States and what have you, but we have never stopped serving in Jamaica. And the point about it is that we are a blessed country. We have everything that we need, except that we do not have people who believe in ourselves, even what is supposed to be the status quo. Once your belly is full, you don't care about the other man. And that is a sad indictment. This was not the Jamaica that I grew up in. And I want to ask everybody out there, how can you see what is happening? How can you know what is happening? How can you have us here and then you have people down there saying the things you're saying? The conference, there are many people down there, but the conference organizers is a joke in terms of what they're supposed to be delivering. What we are delivering, what we're telling our people is what they should be doing on a day-to-day basis. But they're not doing that because they're feathering their nest, right? They're buying out the place, they're selling it out. And ladies and gentlemen, we are going to reap the whirlwind if we do not stop it, right? We must stop it. And we must not follow the misinformation, the disinformation, etc. We must make up our own minds. We know who it is. I mean, I was having a conversation today with somebody about the criminal justice system. And when the gentleman told me the things that they told me that was going on in the system, every facet of it, every corner, the DPP, brothers and sisters, is nothing. And many of you know that. You have to walk with a bag with money if you're going certain places. And that is wrong. I don't have any halo around my head at all. But I'm saying to you, the question is, what are we going to do about it? And I know that many of you go to churches and you pray and what have you. And I'll ask you this, what are you praying for and who are you praying to? Because it is quite clear that the successive governments have used you like pawns, and you sit there and you do nothing. Well, ladies and gentlemen, I do not believe in pawns, and I do not believe in. I wish I could play chess, but I don't have to play this Jamaican chess. It's quite clear. There are only a few winners, the politicians, and those that support them and being subsidized by them. I thank you for the opportunity, Mr. President, and all my colleagues, and for opening the eyes of not only myself, but the people who are listening to us tonight. And I wish and hope that they would put their feet down and decide that we will not have this anymore, regardless of who is in power. Thank you very much.
Ratchet, before you speak, let me just give the number again. 561-757-655-3377. That's 757-655-3377. Caller, go ahead. You're live.
Yeah, good night, gentlemen. I wanted to ask, I think his name is Dr. Dawes. How come I haven't seen stats on, people have died of, say, chronic illnesses? I mean, we've seen stats on murders. I guess that overshadows everything else, but I just don't see stats on it. I don't remember seeing any stats on it because there are a lot of people who are dying in Jamaica from a lot of chronic illnesses, a bunch of cancer and diabetes and all that type of stuff. But since Dr. Dawes is no longer there, I'll just make a couple other comments. So they have this conference there, right? And I guess they're seeking investment. But if you guys notice, have you seen any Jamaican government, the plural, have you seen them gone to Wall Street, for example, and say, Wall Street, we need investment in our country? They've never done that. What they do is they go to the diaspora. You guys sitting on the panel there, me and a bunch of people who are listening to this right now, right? If they go to Wall Street, for example, and say, Wall Street, we want you to come into a country and do investments, right? Wall Street will probably laugh them out the room because when you look at Jamaica's average household income, it's somewhere between $5,000 and $7,000 US, right? Wall Street will not come to Jamaica for that. And by the way, if you want to see what Wall Street is, you can look at the New York Stock Exchange. Let me give you an example. there's a city in Florida, Miami-Dade County, by Opelika. The poor city. It's predominantly black, and their average household income is about 3 to 4 times what I just told you. 3 to 4 times. Wall Street. If you drive through there, you don't see Wall Street through there, right? They're making 3 to 4 times more than what Jamaicans are averaging, and you don't see Wall Street there. What you see is a little mechanic shop, a little cook shop, some type of body and paint shop. Wall Street has no interest in coming into any city where people don't have a lot of disposable income. So what the government does, they can't go to Wall Street with that type of nonsense because they will laugh at them. They just don't make enough for that type of stuff. They sit on top of the diaspora. And then when they're ready, they try and denigrate the diaspora. Recently, they were saying, well, you guys are spending money to your relatives, but they really need that foreign exchange. The remittance that goes to Jamaica, it's the single most money that goes into the country. Clearly not tourism. Tourism money goes into a hoteler's pocket, right? The government gets some type of tax off it, but it goes into this. So when I book a flight to go to Sandals, for example, most of that money don't even go to Jamaica. It stays right here, either in the US, England, Canada, one of these countries. It does not go to Jamaica. So it's kind of sad when you really look at it, because Wall Street will never come to Jamaica, not with that type of salaries that we have there, $5,000 to $7,000, because we have cities in the United States that's making 3 to 4 more times than that, and there's no Wall Street there. Thank you very much, gentlemen. Good night.
All right, thank you, Carla. And I'll just add to that. I was in the Dominica Republic, been there a couple of times, and just to see the amount of international companies, big companies that, I'm talking about major companies that have stores there. And I'm like, when will Jamaica get one of these, multinational corporation coming to Jamaica? And I think it's an issue of corruption, it's an issue of trust, and it's an issue of safety. I think a lot of companies will not want to invest in Jamaica. Carla, so you're right. Ratty, go ahead, sir.
Yeah, let me just go back to the first caller, the gentleman who said buy black. He asked the question, how Jamaica is 92% black/African, and what's the percentage of their investment in terms of creating wealth in Jamaica? I don't know the answer, but I can hazard a guess and say that they contribute mightily because they're consumers, right? And most of them are earning minimum wage, which is 13,000 Jamaican dollars. I think the minimum wage earners, they account for more than half of the population. So he has made a point that should be examined. It should be examined, because if you're calling for change, there's certain things you can do to effect change. And we can even use the example of the civil rights movement in America. That's one of the things they did. They stopped supporting certain businesses. Now, I'm not advocating that people should just get up tomorrow and start doing this. Takes careful planning, but we need to examine this as an option, because some of the points that he raised, and I've heard him before, they're valid. They're valid. Mm-hmm. So I will do a little research and find out some more, and I hope he calls back so we can have a fruitful discussion. Because to be honest with you, whenever he calls in, it's like a one-way, because we don't have the answers. We haven't checked it out. So we're basically absorbing what he's saying. Now it's our responsibility to take that information and do something with it. Research that information and see if there's a way we can come up with a plan to remedy the wrong. The last caller just mentioned that Wall Street is not going to go to Jamaica. It's quite interesting that he made that point, because you know why? Our illustrious finance minister said time and time again that Jamaica has received accolades for paying back its debts. And that is what Wall Street would want. They would want somebody who wants to make the investment and the loan, they can pay it back. And we also have World Bank, IDB, and others who are providing Jamaica with loans, grants, and technical assistance. A lot of that money, we don't know where that money is. Like the 750 million that came in for COVID, we haven't gotten a proper accounting of all of those funds. And those funds came for two communities, the business and poor people. The business class got theirs. Poor people, not a lot of them got theirs. And Herbert will tell you, and he said it several times, because one of the stipulations attached to the funding, poor people have to have access to the internet. You have to have a computer. You have to have a bank account. You have to have this. You have to have that. You have to have. My people, you know, in a St. Anne and St. Elizabeth, they don't have them things there. So they never get no money at all, even though the money come for them. But the evil part of it is that them and them generation going to have to go pay back that loan. Pay back a loan for money not received. It came and it was supposed to be distributed to you. You never get it. And now you and your family members now, them have to make plans now to go pay back that. And the government going to squeeze it out now. They're going to squeeze it out now. So what will happen is they'll make the argument that no, we don't want Wall Street. They'll say, we don't want Wall Street. We want you guys to come back and own a piece of the rock. We want Jamaica for Jamaicans. They'll tell you that. But they don't mean that. They don't mean that, because what they see at the end of the day is a large payday, right? And so they know they can't go Wall Street and fool up Wall Street. But what they're thinking is that they can come and fool up the diaspora because we are EDB red. Well, that might have been the case 20, 30 years ago. No longer the case. And that's why we told people don't go. And we have some people who are there that we know they're there and they're providing information to us. So we have visibility into what is going on there. Let me switch quickly to the DPP and the A. Jeffrey raised the point about, are we paying two DPP, paying the salary for two DPPs? It would appear that way, because I've asked the question. I asked a very simple question. I asked, I think her name is Miss Thompson. I said, is Miss Thompson the acting DPP because the office is vacant, as the court said, or is Miss Llewellyn on vacation, as some government officials would have you believe? And them come back, them couldn't answer the question. Couldn't answer the question. Because any answer them gives a wrong answer, including not answering, which is what they did. Them start telling me, go to the ATI and read this provision, and then go to the Data Protection Act and read this provision. I went, Mama Dell, thank you very much to send me go to school and stay up on top of me and my lessons. Because I went and I read those two provisions and they do not apply to the question. They are inapplicable to the question. But them have to come up with something, so them tell me, oh, we can't give it to you because one is that it will identify the identify who. Everybody know who the former DPP is and who the acting DPP is. And them talk about personal information. There's nothing personal about it. It's all in the open. And in the Data Protection Act, them claim say, the provision they gave me said that if you're a financial institution, you can't get certain information. I'm not a financial institution. So that is what they might, drowning people catch at straws. And that's what they're doing. They might catch at straws and can't give me a good reason. So what did I do? I've appealed it. And I won't stop, because Jamaican people may need enough to understand this. All I want them give some money to go at the conference. And by the way, a lot of the people who show up at the conference, Sunday, the opening night, and Tuesday when the Prime Minister spoke, I've noticed Monday it empty now when the Minister of Foreign Affairs are talk completely empty, right? Them 2 days there, people from various ministries were told to show up. That's what I've been told. That a lot of the people you see inside are government workers are local supporters. They're not people from the diaspora.
And government ministers.
Yeah. Those people used to full up the hall when the Prime Minister talk, they're not, from most of them, they're not from the diaspora. They're not from the diaspora. But they might give a good showing. But you know what, here's the real sign of how much of a failure this business conference is when the sponsors them now start tally up how much money they make. And them say Them have a room full of people Sunday. Them have a room full of people Tuesday. And when them say, well, but me not sell nothing. Me not sell nothing. That is going to be the test when the people look at them spend a lot of money, forget the booth and forget the tables, and them not gonna make back their money. They're not gonna make it back. So that's all I have on them subjects here right now. Oh, a corruption index. We President was talking about corruption as well. The corruption index, Jamaica ranks Jamaica score of 40, I think it's a 43. Jamaica hovers somewhere between 39 over the years, 39 and 42, 43. And anything below 50 is considered corrupt. So Jamaica is a corrupt country run by corrupt politicians. That is corrupt. Because if you remove these people, Jamaica's a paradise, but it's been run by corrupt people. And that's why we need to do something about it, people. We need to stand up and be counted. Don't make them tell you about, we are treasonous and we are this and we are that, because what they must say is that you don't have a right to speak out against the government. And you do have that right. Peaceful assembly, freedom of speech. As long as you're not breaking any laws, and that's why I've said to my people, go and get your permit to protest. Do not give them any reason to come and lick you over the head with a button or shoot you or kick out your teeth. Do not do that. Go and get your permit. And if you apply for the permit and you don't get the permit, then you can always come to One Jamaica Legal Defense Foundation and we will look into it. We will be the people's ombudsman. Not the government ombudsman, the people's ombudsman. We will be looking out for your rights. We will be protecting your rights. So we are ready. We are a ready resource. We are you. We are one. Don't make them fool enough. The fooling time over. They have become wealthy by fooling us. But this is a different generation. It's a different time. And you know the saying, desperate times are for desperate measures. And the desperate measures we are taking is that we are protesting. We are making our voices be heard. We're speaking to politicians. We're filing lawsuits. We're doing deep dive background investigations. When you hear the herbalists, I'm sure say the herbalists, no, Guno. When Guno is probably a fraction away, no. Right? But there will come a time. There will come a time when the herbalist going to cut loose. Watch and wait. And as I said, say, God on time. Mr. President.
God on time. All right, panelists, we have to land the plane. We're not going to draw it out tonight. So we got to do what's right for the people. And ladies and gentlemen, we do have one more call we can take. 757-655-3377. But let me pass the mic around. Herb, just commenting on some of what Ratty was saying earlier regarding some of these deep dives. And I know, as you rightly said, these people are supposed to be government officials, but they don't practice proper security protocols and they're compromised. And if you have people who are compromised, anyone can come to them and blackmail them. How does, these horrible cyber hygiene contribute to corruption? And what are some of the recommendations you think that Jamaica overall should do to practice better cyber hygiene?
Just looking at the questionable activities, which we're still looking into. You have somebody, if you're in a company that has trade secrets and your phone is leaking data to the outside, or your emails are compromised. For instance, she'll use the same password on 5-6 different emails. So she doesn't change her password. She's not competent to use emails or even a cell phone that has been passworded. So when you look at these things, you're wondering now, for somebody with a brain, is this a deliberate act that allows certain people to get access to her data or to listening, or is she just stupid? You know, and it's kind of hard to tell, because if indeed the government that surrounds her wants access to the private information that exists, then maybe they're the ones listening in. We can't tell, because this thing is saying cybersecurity of the subject is low. Email addresses are breached, password leak, subject is reusing password, right? I mean, this is crazy. And then there's links to offshore accounts, individuals with offshore accounts. There is so much that comes up, and somebody who asks it if they're squeaky clean, right? It's just not there. Negative character traits, disgusting, awful, wicked. When you look across the reporting that comes out of our office, as well as the articles that we're seeing, allegations of corruption, handling the Vive cartel case, right? And the incident with the jury. And then we find out by our own admission, there are other incidents with the jury, right? She has issues with prosecutions over the loss of firearms. She wanted to charge Philip Paulwell for his negligence for the theft of firearm from his vehicle. And the fact is, when you look at two GLP members, Robert Montague and Tom Tavares Fenton, they also reported firearms stolen from their homes. And there's no charges that are pending. And then somebody like Tom Tavares Fenton is the father-in-law of the late Dogpaw, who is known criminal to the police, just got on the jail. I mean, you have to wonder, how did his weapon leave his house? I mean, this is complete nuts. Then we have Bailey's roommate, Jermaine Jr. Bodies found in Patrick Bailey's living room. He tripped over it early, maybe 3, 4 o'clock in the morning. And he didn't hear anything suspicious or unusual all night. Man has over 20 stab wounds and a gunshot wound to his head, right? And instead of Fitz Bailey telling us at this conference what is the status on the Bailey case, who was sent to bed rest by his doctors, right? And this man is an affiliate of the JLP. He's the Prime Minister's lawyer. So you can see the exceptional treatment being given to an individual who should be a murder suspect. But instead, Fitz Bailey comes out and tells the people that Bailey's not a murder suspect. Then they try to make it look as if somebody in some surrounding community of Terrelong, his close associate, was the ones who did it. The SSL investigation, the go slow on that, nothing came out of the DP's office to where Mark Golden has accused them of dragging their feet on the case, right? Absolutely zero. And then you have police officers making statements about there's no FBI involvement. After the Minister of Finance said there's FBI involvement. So we have confusion where the DPP's leadership is needed to come out and say, no, here's the thing. All questions come through me, and I will deal with the case and tell you what the dispositions are on these various cases. That kind of leadership does not exist. Never happened, right? So what you have here is a director of public prosecution with a lot of transgressions, a lack of practicing ComSec, which is communication security, all kinds of issues cyber-wise. And the bottom line is she's supposed to be setting the example for the rest of the government. Now, if government receive all this training, how comes we don't see it being put to good use? And by the way, she's not the only one with compromised instruments, cell phones, tablets, and there are people we looked at that have as many as 18 different cell phones that they're using. So what is it that the Labour Party and the ministers of government are covering up? Why do you need all these instruments? I mean, it is crazy. But, you know, nevertheless, we noted that these are government instruments, most of them, and that the email addresses being compromised were government. So this Labour Party or this government have a lot of leaks. They just leak away. So information about Jamaica's highest levels is out there and accessible to lots of folks. We noted when the Integrity Commission report got out that it made a circuitous route through Argentina onto France before it came back around to the US. So you have to ask yourself, how many people are intercepting communications in Jamaica, and this party couldn't care less. They don't have a clue what's happening with their communications. You know, maybe they'll pay attention after tonight, and maybe the police commissioner, who is an IT person, can tell them what communication security is and have them tighten up. But, you know, that's the biggest tip we can give you coming from the white hat side, that you need to clean your act up.
Thank you, Herb. All right, guys, we have to land the plane, so let me pass the mic around, then we'll turn over to Ratty to close us out. Jeffrey, if you go ahead, sir, and make your final presentation, sir. Oh, by the way, before you speak, Jeff, ladies and gentlemen, we, in my capacity as a ethical hacker, I've issued a website that we use all the time to check if your email address has been pawned, and yes, it's spelled correctly. You can visit that website, put your email in. If you get a green banner, then you're good. So go ahead, drop your email address in it at your convenience. It's pinned to the chat. You can click on it after the broadcast. The chat will be available. It's a really good tool that we use when we start doing deep dive. So you can use that link. Also, we keep it here for you. And as Herb said, we're providing you resources. We're even helping them by providing things. Because, I mean, we want Jamaica to be better. None of us want our politicians' information in a foreign advocate's hand. And once we get some of these foreign advocates, holding, compromising, and damaging information on our elected officials. Who knows? They may be getting contracts, or they may be doing things, undercover. And that is why most of the contracts that you see are happening in Jamaica. It's not that you don't have qualified or competent Jamaicans. You find out that you have a lot of international non-Jamaicans who are given the contract first, more than people from the diaspora with the skill sets that they themselves are making really good strides from, but yet still. So we don't want that. So here's a tool to everyone in the government. Use that. Check your email addresses. But that's not going to be enough for some of the things that Herb is talking about. Jeffrey, go ahead.
Yes, I just want to say it has been an awesome evening from Dr. Dawes come all the way up to now. It has been an awesome evening, and we have been doing this as, it dubbed as the People's Diaspora, the People's Program, the People's Conference. And we continue to fight for the voiceless Jamaicans, no matter what they may say about us, no matter what they may dub us as. And we all know that we're not being paid by any political party. We dig deep in our pockets to go to protest after protest and to speak on the behalf of the Jamaican people. My final word this evening tonight, it's now 10:20, 9:20 in the land of wood and no water. My final word to everyone is stand up for what you believe in. Be a part of an organization that can make change for your country. As what Mr. Rattigan said last night, if we don't do it now, then when? When will we stand up for this nation of ours if we don't do it now? And the time has come for all of us to rally around a single cause and a single purpose. A nation that is crying from within. Let us stand up for that gem in the Caribbean, that rock in the Caribbean Sea, that called Jamaica land we love. And so, Jamaicans from all walks of life, put Jamaica first. Don't put a political party first, but put Jamaica first. The land that we're born in, the land of my birth, put Jamaica first. May God bless you. May God bless my island home, Jamaica land we love. Mr. President, over to you.
Mr. Handsome Francis.
Mr. President, thank you, everybody. But I just want to say this has been a real great afternoon. Really into the Herb, you educated me a little while ago. Thank you for that. Everybody has, Ratty, Jeffrey, and yourself, Mr. President. But I'd like to reach out to the Jamaican people, as I've always done, and say, listen to me. One hand cannot clap. You all know it. You know what the stakes are. Stop talking about politics and talk about the survival of our country. And that is really what I would like to emphasize this evening, that we're doing this because we want our country to move forward. And you can help. Many of you have gotten calls, are donating. Remember to donate the OJLDF fund, both on Cash App and Zelle, and the AI stuff is up the top. You can just use it and get there yourselves. Ladies and gentlemen, it is time we take a stand. It is time we stand up for Jamaica, not for us. We in the diaspora need to have complete autonomy, because I know, based on all the conversation tonight, that we can make a difference, because we need investment as well too. Not only Jamaica needs the investment, but if you invest in people in the diaspora, the benefits will come to you. It's already coming to you. Okay? I want you to reason this out. Do not listen to the rhetoric. Do not listen to the lies. This is the time we take hold of Jamaica, regardless of who is in power, and make sure that our country can be safe and be a good place to be and the world will still be envious of us. So with these words, I ask you to remember our national pledge and to continue loving Jamaica as we do. Thank you very much, gentlemen, for being on here with us. Appreciate it.
Herb?
Well, you know, this has been, to me, a very good start at a biennial conference that should have come out of the diaspora a long time ago. I'm pretty happy with what we have done. I'm pretty happy with how we have done it. And as we move along, I am certain we'll get more support because we are the clean ones. We are the ones that are unsoiled. We're the ones that have been speaking truth to power. And we will continue speaking truth to power. And all the mumbo jumbo this week, where the commissioner of police came out and said that they started the Project Star program last year. Wrong, Mr. Commissioner. That was introduced back in 2016. We did that. And Dr. Chang, in his impertinence, ignored us, said he wouldn't go down that road, and now he has to come down the same road he said he wouldn't go down this year. The only problem is we're not there to direct it. We briefed not just Dr. Chang and the illustrious Minister of Foreign Affairs, we also briefed the private sector about that program. In 2016, imagine, Dennis Chung was there, and he's now Secretary General of the Jamaica Football Federation. So how do you ignore a program for 8 years and then come back to it to save your buns? You know, this is who we are. We research. We look into the efficacy of various programs, and we make recommendations. We also have people who would like to help you to initiate and administrate these programs, because these people have done it before and they know what they're doing. But Dr. Chang decided he did not want our involvement. We can come down and give a speech, but we can't get involved. Now, you know, for whatever it does matter, and I've said it before, we are here to serve the underserved people of Jamaica. All the other elites, as mentioned by Professor Clayton yesterday, seem to float above all these issues, and only the underserved people seem to be impacted or affected by certain issues. But we're here and we're going to continue to work to serve those people and to ensure that government, whichever P it is, they will journey on the straight and narrow path if we can help it. Thank you.
Thank you, Herb. Before Ratty come on, he's gonna give you the schedule for the rest of the week. But I just want to let you know we're not finished. This is not our last night. We're not following them, so keep that in mind. But I'll tell you what, though, we want to do some fundraising, and in my closing, I'll remind you, we definitely need your financial support so we can start this next phase of legal actions. And without funds, we can't make any move. So we're gonna need you guys. Our fearless leader, Mr. Wilfred.
Yes. You mentioned the schedule for tomorrow or for the rest of the week. I'll just give it for tomorrow. Tomorrow we're going to be looking at tourism.
Sorry, Mr. Rattigan. The ladies that can't see your face, you know, you're hiding your face.
Oh, sorry. Yeah. How about now?
Yep.
Okay. The schedule for tomorrow is tourism. We're going to talk about the fallacy of tourism. They've said that tourism is bringing in buku bucks, and we know that's not true. And we're going to talk about it tomorrow. And we're going to hear from a tourism expert, somebody who spent many, many years in the Ministry of Tourism. We're also going to hear about the economy, the false narrative about the economy, and both speakers will identify the issues as all the previous speakers, and then they're also going to provide solutions. We don't care about sharing solutions with the government or anyone, because at the end of the day, them can't say, I just talk where I talk, and we identify problems. We're not providing solutions. We're doing many, many things, including providing solutions. So I want to thank all of you for showing up to the People's Conference, the conference where real issues are discussed by real people providing real solutions. 2-3 years ago, if you had asked me, if you had told me I would be here doing this, I would have said to you, you're crazy. My journey started about 2 years ago. I mean, real journey, doing what I'm doing now. And this is not work, it's a passion. And you know what they say? Find a job you love and you will never work another day in your life. I love what I'm doing now. Why am I doing it? I'm doing it for you over there, sir. You around the corner, you up top, you below, you doing for all of you. I'm doing it for those of you who can't access your beaches. I'm doing it for those of you who are marred, scarred, defeated by corruption. I'm doing it for those of you whose constitutional rights have been violated and you don't even know about it. We're making you aware. I'm doing it for the people getting the $13,000 a week. And by the way, that's most of you. I'm doing this for people who cannot get proper medical attention, including some who have perished as a result of that, including my good friend, Mikey, who waited 3 hours for an ambulance to take him from Medical Associates to University Hospital, and he died before he could get medical attention. I'm doing this for those of you who are sick tonight and you don't see a way out. In fact, you're staring death in the face. I'm doing this for the poor people, the people who are hopeless, the people who are depressed, the people who see no future. They see no prosperity. All they see is poverty. I'm doing this for all of you. And by doing it for all of you, I'm also doing it for myself. Because as some people have said to me, this is a calling. I could be doing a lot of things. And instead, here I am every night this week and most nights during other weeks, doing the things that I feel are necessary to get the government to change course. I'm not trying to change government. I am trying to get government to change. You, the people, the voters, you are the ones who will make that change, who will change government. I can't change government. All I can do is petition and force the government to do a course correction, to change. But you know what? It's not going to happen. We've had 8 years so far, and it's getting worse. I don't want to take up much more of your time because there's so many things we want to talk about. But tomorrow when we start talking about the economy, we'll have a lot to say about how you've been fed this false narrative that Jamaica is doing well. And then when you look around you, all you see is poverty. Where is the promised prosperity? Where are the people who have moved from poor class to middle class? I want to see them. And so I'll leave you with this. I said it a few nights ago. It's worth repeating. It's worth repeating. It's worth repeating. If your plan is for 1 year, plant rice. If your plan is for 10 years, plant trees. But if your plan is for 100 years, educate your people. And that's what we're doing around here. We're taking action and we're educating our people. On the walk good, sooner tomorrow. President.
Thank you, Will. Thank you, Dr. Rupert. Thank you, Herb. Thank you, Jeffrey. And audience, most of all, thank you for being here. You're the best part of being for this conference. And let me tell you this. You know that every great movement begins with an organic group of people who are frustrated and sick and tired of everything that is happening, and they want change. Change happens when we get tired and sick and tired of the crap, and we want to do something about it. And that is why we're here. That is why you're here. That is why you took the time, you dedicated these hours so that we can have engaging conversation, so that we can come up with strategies and formulas, so that we can empower and enlighten. The conference continues. But let me tell you this, what we're doing is not a joke. We're planting and we're creating the root system, the foundation of the transformation that our country needs. And you are the glue, you are the cement that's gonna make that happen. We're gonna do big things. So get ready. You see, a lot of 9-day wonders happen, but you don't get people who are authentically and genuinely committed like what you've seen with this team. And this is not a joke. Now, Ratty and Herb and Dr. Frdncis and Jeffrey, they've been doing this a long time. I've been doing this quietly. I'm a radio guy. I'm local on radio, not on social media platform. But when I saw that there were like-minded people who think like I do, like you do, I had to join and become a part of this. So have you. So I see some of you are asking to volunteer and asking to come in. It's the same process. It's very easy. All you have to do is simply shoot us a text at this number, and we will be more than ready to work with you. I want to big up the team that's doing the work, Marva, Omar, and the team. And you guys have been doing a phenomenal job, and we're accepting as many of you who want to serve and become a part of it, because we have a lot to do and a lot coming. But we need all hands on deck, and we need your help and participation. Renisha Swaby, you're phenomenal. President, love you. And let me tell you this. A lot of you out there who are ready to really start making change, don't just jump and do something without thinking it through. Come with us. Let's sit down, let's strategize, and let's approach this. As we'll always say, you have to do it within the confines of the law. You operate outside of the law, it's not going to work. We're not saying don't send any money for your sick mother who wants to go to the hospital, or your sick family member, you don't want to send a barrel to feed them. But we're saying let's look at ways, solutions to let the government know and let the country know that even though we may sleep and work in another country, we're Jamaicans, we're neighbor string cut there, and even second and third generations all have that spirit. So let us keep that fire blazing. Tomorrow we continue. We love you. You're amazing, and you're the best part of this conference. Bow your heads as we close in prayer tonight. Father, we thank you as we come to the end of this day. We ask you for your presence to go with us. Bless those who are in a time zone where they will sleep. Bless those who are awake across the world, wherever they are. It could be the sunshine or early in the morning. Wherever your people are, you are there. I pray that you'll bless them. And those who will see this in the future, bless. I thank you tonight for everything that you have done. I pray that you'll bless all the panelists. Bless Will and his house. Bless Dr. Rupert and his house. Bless Jeffrey and his house. Bless Herb and his house. And I pray, Father, that you will bless me and my house. Bless all on this line and our houses. And I pray that you will keep us until we meet again. Amen. Have a good night, everyone. Thank you for being here. You're awesome and phenomenal. And the team, come on, man, blow the people them some kiss, man. Come on, Dr. Francis. Blow the people them some kiss, man. There you go. All right. Make we talk, family. Everybody and make we talk. Big up on yourself with Jeffrey Tavares. And Jeffrey, you always have the breaking news. How did the earthquake go? You did have the breaking news yesterday about the earthquake, but whenever you're not update. Anything?
Well, I have been on the news thing from morning. I got up this morning and I went and did some stuff. Then I came back in. I had to go to another appointment. I came back in time to come on to you.
Unity strength.
So I didn't check in the news as yet.
Make we talk.
Right, I always keep
if we see corruption in any shape or form, we're going to highlight it. Make we talk. Jeffrey Tavares represents yard and broad of the entire diaspora. As long as it affects the life of our nation, uncover the truth, make we reason, make we talk. And we don't care about no vumva viva va, no upper echelon, nobody is not above the law. As long as it now help Jamaica, make we talk. Make we talk. Unity strength, make we reason. Make we talk. If we see corruption in any shape or form, we're going to highlight it. Make we talk. Jeffrey Tavares represents yard and broad of the entire diaspora. As long as it affects the life of our nation, uncover the truth, make we reason, make we talk. And we don't care about no vumva viva va, no upper echelon, nobody is not above the law. As long as it now help Jamaica, make we talk. Make we talk. Unity strength, make we reason, make we talk. If we see corruption in any shape or form, we're going to highlight it. Make we talk. Jeffrey Tavares represents yard and broad of the entire diaspora. As long as it affects the life of our nation, uncover the truth, make we reason, make we talk. And we don't care about no vumva viva va, no upper echelon, nobody is not above the law. As long as it now help Jamaica, make we talk. Make we talk. Unity strength, make we reason.
When the game gets rough and this life just seems so tough, make we talk, my people, make we talk. When this town becomes an ugly place, don't let it erase the smile from your face. Make we talk, people, make we talk. Conversation is the key, a guiding light for you and me. Spark a talk and you will see. Conflict solver A to Z. World leaders master the art of self-defense just by talk. So people, make we talk. Hey, we're living in a world that on ourselves we must depend. Make we talk.